Hello, everyone. Hi again. If you were on earlier, you would have met me. My name is Tracy Broadhead-Fripp, and I'm your host today. Welcome to Physician Medical Forum's Doctors on Board and Community Health Ambassadors virtual program. It's an interesting time that we're in, and we're excited to be able to share some time with you today. We've got a wonderful program planned. We've got students and doctors from all over the country joining us in all different time frames. So why don't we go ahead and get started? We've looked and seen your beautiful faces, but now it's time to meet our beautiful Executive Director of Physician Medical Forum, Ms. Stefan Bello.
Good morning. Sorry about that. Can everybody hear me now? Carolyn? Okay. All right, great. So I am Stefan Bello, the Executive Director, as she said, of the Physicians Medical Forum, and welcome to our first virtual Doctors on Board and Community Health Ambassadors Internship Program. As you know, all of us have gone through quite a bit of the COVID-19 coronavirus, and of course we had to move from our 10 years of doing in-person programs to now virtual programs. We hope to have many more in the future, and we hope to try to make them as interesting as possible for you. The Physicians Medical Forum's job, our mission, our goal is to support you in your goals to become doctors. And not only that, but to support residents and physicians in some of their endeavors too, to keep us all healthy. I am proud of each of you. We are proud of each of you, and we want to encourage you because as you see now, it is so needed to have many doctors, especially doctors in diversity and of many backgrounds. So with that, I'd like to try to introduce our president, Dr. Albert Brooks, who has been made, and would like for him to start. Thank you.
Good morning. Good morning. Is everybody awake? I'd like to welcome you, as Stefan said, to the 2020 Doctors on Board program. We've been doing this program for 10 years, and we're going to do it for another 10 and then another 10. So I want to thank you for attending. As Tracy and Stefan said, this is an amazing and unprecedented time in the USA and in the world. We've got two pandemics. We've got COVID and we have racism. And guess what? You future doctors are the answer to both of those problems. By becoming doctors, I know you will be able to save lives, all lives, but in Black lives, and they're disproportionately affected by COVID. So in fact, you have a special task ahead. The other thing is, by becoming a doctor, is you will help eliminate health disparities in communities of color. So you've got two edges to your sword. We are so proud that you have made the decision to pursue becoming a doctor. The 7 African American physicians on the Physician Medical Forum board know you can do it. So let's have a great day of learning what it's all about and how to do it. Thank you.
Thank you. Thank you, Al. In addition, we have our wonderful Dr. Cara Miller, who's at UCSF, and she is the secretary of the Physicians Medical Forum. We'd love to have her say a few words to each of you students. By the way, Carol, students are coming in on this session from all over the country, as Tracy mentioned, and including Canada. So thank you.
All right. Thank you, Stefan. Good morning, everyone. I hope you can hear me as well. I too am thrilled that so many of you chose to attend PMF's program for aspiring doctors. My story is likely similar to many of yours in that I come from a family of modest means. My parents were not college graduates. There are no physicians or other professionals in my family, and I certainly don't look like the typical image of a doctor. I did not have role models with whom I could identify, which is why I, along with the other doctors you'll meet throughout the day, are here with you. Role models say, you can do this too. So as you experience the program today, use what you are learning to start the process of creating your personalized plan to becoming a doctor. This should include your vision of why you want to be a doctor, what kind of doctor you think might fit best with your interests, what steps do you need to take, and what questions do you need answered. Consider mapping out your own personal timeline for each step. Create an image in your mind of you as a doctor. Everything starts with the mind. And then return to that image frequently as you move forward to help keep you grounded, focused, and believing that you can do it. I wish you a wonderful day of learning and never stop believing in yourself.
Thank you, Carol. In addition to, this is a little off script, but I think Dr. Navarro is on.
Yes. Hi.
Yes.
I am.
Okay.
Hi.
And I was hoping maybe you'd want to say just a few words.
Well, thank you very much, Stefan, for the opportunity. Good morning, everyone. I'm Dr. Renee Navarro, and I am so proud to be a member of the PMF board and to also serve as the Vice Chancellor for Diversity and Outreach and a Professor of Anesthesiology at the University of California in San Francisco. We are just so delighted to have you participate in this program because we are committed and we recognize the critical need for the diversification of the physician healthcare workforce. As the others have said before me, we sit at a crossroads and we recognize that the care to our patients, to all of our patients, is improved with a diverse workforce. Therefore, this hopefully is a great step forward for you. We're here for you and here to support you in your endeavors. Please don't hesitate to take full advantage of this program and to reach out to us. With that, I want you to get on with your program, have a great program, and have a great engagement with us. And best of luck to all of you. Thank you and welcome.
Thank you, Dr. Navarro. Is Dr. Mcdonald on yet?
Yes, I'm here.
Okay. Dr. Mcdonald is a cardiologist and he's also on our board.
Hi.
Sorry, my son walked in right as you were introducing me. That's my 3-year-old Ellison. But thank you everyone for joining us. My name is Chip McDonald. Ellison, I need you to go in the other room, please. My name is Dr. Chip McDonald. I'm a cardiologist in Oakland, California. I'm with Stanford Healthcare and Cardiovascular Consultants Medical Group, father of 3. And I just want to welcome you all today. You know, amidst everything, Ellison, please go in the other room. Amidst everything that's going on, pandemic, fires, all the of course, issues with racial injustice. I'm just so delighted to see so many people logged on this morning, this Saturday morning, motivated and ready to get to work on your path to becoming physicians, because we need you. And as others have said, you know, all of us doctors on the telephone, on this Zoom, have had mentors and still have mentors who we've relied on throughout this journey. And so PMF wants to be a resource for you, and we hope that you will take advantage of the resources that are made available through the program. So again, welcome and thank you, and sorry about the the interruption there.
Thank you, Dr. McDonald, one of our future new doctors. Okay. And then finally, I think Dr. Peters or Dr. Carey, are either one of them on? Okay. All right. Dr. Strudwick? Okay. And then
I'm here.
Okay, could you just say one quick message?
Yeah, I appreciate, as a board member of PMF, I appreciate the opportunity for the interaction with the students. I too am a father, and I'm sure that someone in this program today will probably be my kid's doctor someday. So I fully support your journey as a physician myself, an orthopedic surgeon, and as a dad. So have a great day. Have a great day.
Okay, thank you, Dr. Strudwood. Is it
Steph
Dr.
Curry moment.
Dr. Peters or Dr. Carey? Either one of them, or is Tiffany Slidick?
Dr. Peters is on. I just want to say hi. I'm a psychiatrist, a professor of psychiatry at UC San Francisco, and I welcome you all and have a great day for this program.
Dr. Peters is the president of the Alameda Contra Costa Medical Association. So thank you all. And Dr. Carey is not on, right? Okay, all right. And Tiffany Slidick from Princeton Review, is she on? Okay, all right. All right, with that said, I think we should move ahead and just have a few housekeeping things I'd like to go over. One, some of you have never participated in our Doctors on Board program. So we want to make sure that you understand that many students have. And so if this is your first time, it's just awesome to try to just listen and absorb and try to follow along, because we will have others, including, as I've said earlier, the mentoring and the sessions, the networking, the mock clinics, the surgical mock clinics, the primary care ones, and so forth. So I just hope that this is as valuable to you as much it is to us in terms of presenting and preparing for you. Finally, I want to say this because we all need to be caring. We all need to be mindful, and we all need to be thankful. And there is a wonderful team that has worked very hard under these very challenging times to put this program together. And so I definitely want to thank, of course, Tracy Broadhead-Frith, who is our MC, as well as Ogoma Ise, who is wonderful and has worked with us and has been our co-chair of our Doctors on Board when it was in person. She is at UCSF and an MD PhD candidate. Donna Tape, who is our web designer and graphics designer. Carolyn Washington and Devonna Hayes, who are both our program assistants. Did I miss anybody? If not, I just want to thank you all, because we couldn't have done this without you. Okay. So with that said, I think we need to move to the next step, and I think it's ready for Dr. Italo Brown in terms of his first workshop presentation. Welcome, Dr. Italo Brown. He is at Stanford University. He's an assistant professor, and he's an emergency medicine doctor. Welcome, Dr. Brown, and would you proceed? Thank you.
Sure thing. Thank you, guys. How's my sound, everyone? Perfect. It's a pleasure to be here. This is an event that I think I'm starting to see how much of a family it really is. And everyone that in the years that I've done this, come across that has attended has had amazing reviews about it, and I've even seen some familiar faces among the participants today. So I'm happy to be here, and this is going to be a pretty a new take on something that we've been doing for a while. So let me go ahead and start the presentation so I can get this going. Okay, so we'll proceed forward. So, all right, everybody has questions about the different types of medicine that you can practice. And this is one of those moments where you have to look deep into your soul and say, like, what is your calling? We know you want to be a physician, but are you familiar with all the different pathways that you can take as a physician to provide care to people who are in need? So it's not as simple as just saying, I want to be a doctor. Go ahead, put some scrubs on me in a white coat, and let's go to work. There are different types of physicians, different specialties, different requirements, and the types of patients that you treat may be up along a spectrum. So we're going to talk this morning about those different avenues in medicine that you can practice, the different disciplines, the things that it takes to accomplish those different specialties, and what's the best fit for you. So hopefully by the end of this conversation, what I'd like you to be able to do is at least have a broad stroke understanding of various specialties within medicine, how medicine works, and how we interact together to provide optimal care for patients. So the first thing I want you to do is stop for a second and ask yourself a serious question when it comes to medicine. Like, what do you want to do? You know, like when you go to sleep at night and you have a dream about being a physician, how do you envision that dream? Do you see yourself in an operating room? Do you see yourself with pediatric patients or children? Do you see yourself delivering babies? Do you see yourself in a dark room looking at imaging? These are things that should be racing through your mind, and not necessarily in the most defined way, but there should be a vague picture that develops when you start thinking about being a physician. So there's some questions that you can ask yourself to help guide along the way. First one I'd say is, do you want to cut or do you not like cutting? You know, some people are freaked out at the sight of blood, the sight of any type of organ system up close. And so that may change what you choose to do. Old versus young versus everyone. So do you like people who are octogenarians or 80-year-old folks who are sweet and love you just for bringing them a pudding cup? Are you more so into the young babies holding somebody who every time they cry, poop, and pee, it is cute to you? I deal with everybody. Doesn't matter what age, as long as they have a medical issue, I can solve it. These things are going to come into play. What if you don't even like people? What if you prefer to look at images or look at cells? Like, those things matter, and it could change your entire trajectory as a physician. Do you want to work inside a hospital, like the TV shows where you're zipping through hallways and taking charts from people and talking to nurses? Or would you prefer to have your own practice and be an entrepreneur and have people come to you and have everything in your own suite? These questions, again, are going to help frame your decision. Now, I know most of you are sitting there. I can see you on the Zoom layout right now, looking like this person in the center here. Now, for those of you who watch Blackish, this is Bo, from Blackish. She is an anesthesiologist, but I mean to take that image of her kind of feeling confused and saying like, all right, you know, this sounds like a lot early in the morning, especially on a Saturday. And then some of you are looking like this person over here, Z, right? And she is interested, perked up. And so I'm going to try to get you guys who look like this person in the front to look like the person in the corner while we discuss this. Now, in terms of understanding medicine and how we've structured it here in the US, there's a clear delineation between primary care and specialty care. So I'm going to spend a couple minutes now speaking about primary care because it tends to be in most places the I guess, foundation of medicine. So primary care, it's that entry point. It's the gatekeeper, so to speak, of medicine. You want to know about primary care because when it comes to the way that things are funded, the way that we develop our standards of care, a lot of it is built upon primary care. And in a time like now, where everybody is going to the doctor to be seen for certain things, primary care as a field is of utmost importance. So, as I said, they're the gatekeepers. They're the people that you come in contact with first. So anytime that you've seen you say, hey, that's my doctor, Dr. Brandwine. I've been seeing him for a number of years. That's a primary care physician. They're usually people who have complete access to multiple elements of your health history. So they don't just treat one issue, they treat multiple issues. And they specialize in continuity, which means that they see you for multiple times throughout a year or throughout a period of time, right? So the same doctor who's doing your physical for 4 or 5 years, the same person who's seeing you for your asthma management for multiple years, that is the continuity that we speak about. The primary care is composed of 4 disciplines, and one of them I'm going to put an asterisk by, but they are internal medicine, family medicine, pediatrics, and gynecology, or particularly OBGYN. But I put an asterisk there because when we get to specialty care, I'll talk about the obstetrics portion as well. So these are defined as primary care because they are essentially like the basis of health and wellness for every type of person, right? And we state that in the US, you should have access to each of these services, each of these particular health fields. They typically take 3 or 4 years of training. The 4 years would be your OBGYN. Everything else is 3 years, and that is at the entry level. From these, you can springboard into other things, but just the basic understanding, 3 years of training, that's 3 years of residency. All of these specialties I named, this is the part where if I was sitting at home, I would take a screenshot of this, is that it's eligible for loan forgiveness. That is huge, right? We just got our loans forgiveness extended through the end of the year. But when it comes to racking up debt in terms of medical school, you want to try to find ways to offset your loan burden. These 4 specialties do that. They give you they make you eligible for a certain loan amount of loan forgiveness. The base pay, as I've shown here, is between 160 to 250K. This is average. It doesn't mean that it's the ceiling of this pay, but this is what we have in terms of published material, and it says that this is the base pay. So let's get on through some of these specialties. Internal medicine. So as you see, I got a picture of T'Challa here, the Black Panther, and notice how he is looking up and he sees everybody. It is village folk, all cascading throughout the mountain or the side of the waterfall. That is essentially how I view internal medicine. They see adults from the entire spectrum of adulthood. They deal more so in not just diagnosing illnesses, but preventing them and trying to manage those conditions. So I mentioned a few earlier, like asthma, but they also do things like diabetes management, high blood pressure management. They can do structured programs for weight loss. They do an entire spectrum of things. And many internal internists have, I would say, extended knowledge in some fields. Like they're very good in baseline understanding of cardiology, baseline understanding of nephrology or renal stuff or kidney things, as well as lung and pulmonary things. So I would say that this is somebody who is definitely invested in the education, in the knowledge of medicine, and the practice of finding out how to fine tune somebody's conditions. They work in both the clinic and on the wards, or they can do one or the other. Now, they do not go to the operating room. That's an important distinction. You're never going to find an internist. If you do find an internist in the OR, they're probably looking for something, and you should tell them to go back to where their domain is. With that said, their hours are pretty flexible. You can see that most internists have either a schedule of working, 2 weeks out of a month, or they cover nights as a hospitalist for a couple of weeks, and then they get a couple of weeks off. Those that work in clinic will say they set their clinic hours and they do those clinic hours consistently. The last bullet of opportunities is pretty important because as an internist, you have to get this baseline or foundational understanding of medicine before you go into things. Earlier, we had a board member who's a cardiologist. That cardiologist had to learn internal medicine first. They had to understand all of these disease and these organ systems and how they interact and the disease pathologies that align with those before going into just the cardiovascular portion of that organ system, or rather. So I think that if you're interested in one of those particular fields, I want to be a critical care doctor, I want to be a pulmonologist, you need to start here. All right. Family medicine. So I have a family here. Some of you may be familiar with this family. It's from the movie Us. I think that it's pretty cool to have representation. But the reason why I put this up here is because you see a spectrum of ages, right? So it's a young kid, you have teenager, you have 2 adults, 1 male, 1 female. So family medicine physicians have that capacity to see everybody. It doesn't matter, whether you're talking about a child or you're talking about an older person, they tend to see that. And they specialize in that continuity of care. Some family physicians, depending on the location, may see somebody from birth through their, well on into their adulthood, right? So think about that. If you're someone who lives or wants to live in a very small, tight-knit community, you can make a considerable amount of money as the primary physician for a lot of people in a small town. They see everybody, as I said. They do the general management and maintenance of people's health and conditions. They can work in the clinic or wards or neither. They can do what I would consider concierge medicine, which is just come to somebody's house, practice medicine, and then go back to doing your thing. They do not go to the OR. Hours, for the most part, are pretty flexible. I would say that most family physicians I know live pretty good lifestyles because they can kind of bend in and out of what they want to do. I know some that do nursing home care primarily and then do clinic on the side. So there's an entire amount of a different amount of combination of things that you can do to make a pretty good lifestyle for yourself as a family physician. Pediatrics. So these are two children, the West children, as I like to call them. They are much older than this picture now. But if you are somebody who, when you first saw this picture, the thing you said was, "Aw," that's probably a good indication that you like kids. And for people who want to practice medicine and help children, being a pediatrician is not only extremely rewarding, but it is probably one of the specialty or the fields that I would say you have an endless amount of patience. Like pediatricians, they see children from newborn to the age 21, and even sometimes older than 21, depending upon where they're at. I think that the cool thing about pediatricians is they do the general health management of children, but also have some special knowledge about certain childhood illnesses, things that most people commonly don't understand. For example, like right now, everybody's talking about how COVID affects people and with going back to school, how that could make a bigger implication on things. These pediatricians are like your experts on that stuff. They know about school. They know about return precautions. They understand the disease processes. So they're extremely helpful, not just to children, but to parents. So think about that. They work in the clinic. They can have wards, which basically, when I say wards, I mean working inside of a hospital where you are doing rounds. So on any medical TV show where you've seen a person walking around and they got like a troop of people, like little minions following them, that is what I would consider the wards, where there are patients who are admitted. And then they don't go to the OR. Some specialists who have pediatric backgrounds do go to the OR, but this is not that case. For the most part, I would say the hours are pretty flexible. I think that you still have to keep in mind that children can get sick at any point in the day, so you almost have to do extended hours in some cases. And there's tons of opportunities to subspecialize. We have pediatric emergency physicians here at Stanford as well. We have any of the major areas of pediatrics, of medicine, like critical care medicine, pulmonology, nephrology. You can be a pediatric specialist in those fields, but the route is to go through P's and not through internal medicine most of the time. All right, another family that we know of. This is Hove and the Queen. So we will say that obstetrics and gynecology is a hybrid. I mentioned it earlier and said that I want to put an asterisk by it because, to me, this is the only specialty where you have the skill set to be both a surgeon and a primary physician. So let's dispel that myth right now. If anyone has ever told you that someone who is an OBGYN is not a surgeon, that is not true. They do perform surgical procedures. They do invasive work. So I want you to know that this is, again, eligible for loan forgiveness, but also has surgical elements to it. They specialize in the complete care of the female patient from top to bottom, from front end to back end in terms of lifespan. I think that most people start seeing an OBGYN in their teenage years. Most women start seeing it in their teenage years and can see one all the way up into like older adulthood. The key here is understanding the spectrum of things that they cover. Everything from just birth control to performing hysterectomies and removal of fibroids or masses and things like that. I think that is important, an important distinction. Can do clinic work, work in the wards, and in the operating room. All of these things are fair game. All right. And I think that the major part when I say lots of opportunities is because there is becoming a new space, or I want to say new space. There's becoming a greater interest in reproductive health, right? So we know that maternal mortality rates are increasing. So that a lot of people are trying to figure out this problem through research. Also, people want to have children at older ages. So doing like fertilization and working on reproductive things are becoming extremely popular and extremely lucrative. So think about that. All right, I'm gonna do a quick check to see if everybody's still with me. Throw me a thumbs up if you're in. Cool, I see you, I see you.
I'm with you.
I love it, thank you. If you talk to me, I'll talk back. All right, let's go. So specialty fields that I'm going to really try to break down. We've just rounded out the entirety of what I would consider your primary care fields. Specialty fields, now this is for you all who, when you laid down at night, you said, I see myself in the operating room, walking in like this, scrub me in, scrub me out, hand me this, that is like the entry point. But there are other specialties that most people don't think about, right? Like, who knew that there was something called an otolaryngologist? Who knew that you have people who specialize in just skin and cutaneous conditions? Well, today we're going to talk about those things. All right. So the main thing about specialty fields is that that specialist focuses on just one particular organ system or specific arc of organ systems, or they focus on just one population. It is the narrowed version of the even narrowed version of the narrow, right? So literally surgical type precision with what they focus on. They typically have some degree of invasive care, meaning that they do something with that organ system that may require a higher level of care, a higher level of procedure. And then because of that, it requires more training. So you're looking at minimum, usually 4 years. And then at the upper limit, you can have as much as 7 years, maybe even more if you do research in the middle of it, right? The base pay is commensurate, meaning that because you spend more time training and because you are so specialized, they are going to break you off. You're going to get more money because of those skill sets. And then finally, the part that is like the major kick in the shin is that they are usually not eligible for loan forgiveness. So I'm going to say that again. This is one of those slides that you should screenshot at home. They are not eligible for loan forgiveness unless you are OBGYN. Cool. All right. Hold on. There we go. So let's start with my favorite person again from Blackish. So she's saying, I make sure people don't die. It's actually pretty true. In the OR, the anesthesiologist is kind of like the DJ. That's how I view it, right? Whereas the surgeon might be the MC, the anesthesiologist is back there on the ones and twos. So they manage the entire care before, during, and after procedure. All right. Think about how much information you need to know and understand about procedures and not being the one that does them. Know about medications that are going to bring a patient to a level of sedation where they don't feel pain or their body doesn't react violently to what's happening on the operating table. And then afterwards, managing that patient so that they come back to a point of consciousness and that their pain is controlled. That is an anesthesiologist's swan song, right? They are usually seeing adults, but can see kids if you specialize in pediatric anesthesiology. All right. They do airway things, which is kind of like what makes them these, what I would consider I wouldn't call them jack of all trades, but these kind of like Swiss Army knife characters, because not only do they manage medicine, not only do they know critical care stuff, they also understand how to get an airway, which means if the patient has difficulty breathing, or if the person needs to go to a procedure and they need a tube placed in their mouth, down their throat rather, to help them breathe or to mechanically breathe for them, they can do that. And they can operate the breathing machine. So the main part about this is they usually do not do clinical work. They specialize in what I would consider OR medicine, pre-post medicine, and sometimes we'll do critical care medicine. So you can have anesthesiologists that also serve as critical care attendings and specialists. They get paid pretty well. I have several buddies who do anesthesia, and when I tell you that I call them and they say I'm on the golf course, I believe it. I believe it. But they also have to wake up right before the rooster does. So understand that if you're someone who this morning had trouble, like my man who's rubbing his eye right now, if you were him, you may want to reconsider. For sure. All right, let's keep it rolling. Dermatology. Staying in the Blackish theme, right? So Yara Shahidi, so known for her immaculate, flawless skin, right? As well as high cheekbones. Well, dermatologists have two things that they can do to help everybody achieve their own inner Yara Shahidi-ness. One is they can give you skincare regimens that are out of this world. Two, they can do Botox. So I say that to say they not only do things that are just general cosmetic, but more so the management of skin disorders. So think about, disorders of skin, hair, and nails. So think about somebody who has like a weird mole or something that they want to have examined. And what if it turns out to be a cancer? What if it turns out to be a rare skin condition? Or you have like very, very bad, poorly controlled, acne. These are people who essentially can change the entire way somebody perceives themselves and the way that other people perceive them. So their power is not just in treating skin, hair, and nail issues. It's sometimes in rebuilding confidence, sometimes in giving somebody peace of mind. So I think dermatology is usually undersold. But if you ask them, that's perfectly fine because they're usually highly intelligent. They perform well on exams. They get paid extremely well. They can pick their own hours most of the time. So I know dermatologists that end at 3 every day, 5 days a week. I see you from 8 to 3, and that is how it goes down. Don't call me on the weekends. We'll see you in the clinic next week. They don't go to the wards. They don't go to the OR. I think I want to emphasize that part about as a field, it is one of the most competitive specialties. So bear in mind that this is like, I would say most competitive, probably something like plastic surgery, then dermatology. All right. Cool. All right. Emergency medicine. There goes my family. So I am biased as an emergency physician. In my mind, it is one of the coolest specialties. So I'm going to try to come from a place that is more midline rather than fully on the side of everybody on this call. All 70-something of you guys be ER physicians. So what I want to highlight here is that the spectrum of things that emergency physicians handle is wide, right? We have to be able to speak the language of every other service and know something about every other service. So you do a little bit of critical care medicine. You do a little bit of invasive procedures. You do dermatology, ophthalmology, ear, nose, and throat. You suture, you reduce shoulder dislocations and hip dislocations. You you splint broken bones. That is like your storehouse. On top of that, you deal with homelessness, substance use, domestic assault, like a bunch of other things that happen to come to the emergency department because all of these issues may require immediate attention. They see everybody, right? So, You can have a pediatric patient right next to a person who's 97 years old. Got to know what to do with both. I'm talking about a 2-week-old baby and a 97-year-old young 97-year young person. I say that it is a hybrid between primary care and surgery because when it comes to trauma care, particularly understanding how to resuscitate somebody effectively and how to do certain procedures that are life-saving, they are invasive, which gives us the distinction of being a surgical specialty. But it is not going to the OR. So let's make that clear. I'm not going to show up in the OR and scrub myself down at all at any point. I chose this life. But if you need me to put a chest tube in to save a patient who's been shot in the chest, I know how to do that. If we're going to do anything invasive to, reinflate a lung, I can do those things. We also intubate patients like anesthesiologists do. So usually airway management is something that's in our spectrum, is in our wheelhouse as well. Very flexible hours. Most ER physicians work anywhere between 8 to 14 shifts a month. That's 8 to 14 days a month. Hours are usually 8 to 12-hour shifts. And so if you do the math, that gives you about a good 2+ weeks of do what I want to do time. The hard part is these hours are not all contiguous, or they're not the same. So you may work nights, you may work midday, you may work morning, you work holidays. So understand that the emergency departments are always open. So you need somebody there who knows what they're doing. But because of that, there's always a job for you. And as you've seen in COVID-19, emergency physicians can have kind of been shifted into a specific light as frontline workers, people who have interacted with COVID-19 at an intimate level. And we'll talk more about that later. But I want you to know that through emergency medicine, there are tons of opportunities. People open their own clinics. They open their own, they do other things outside of emergency medicine as well, work in politics, everything and the like. All right, so this is the homie from Stranger Things, and I don't know if you've seen this scene, but basically she crushes a can with her mind, and that's how I think about neurology and neurosurgery. They are some of the most intelligent people that I've ever come across, and as a field, understanding parts of how the mind works is exciting. It's still the only two fields that I know of for the most part where we don't have a significant portion of it figured out. There's still learning that's happening. So how am I on time, guys? Uh-oh. All right.
You have about 15 more minutes.
Perfect. I think I'm almost at the point of this. Cool. So neurology, neurosurgery, not the same thing. Neurologists, they are the ones that I would say understand the disorders of the nervous system, kind of follow things from, I put here in bread and butter that they will do things like understanding headaches, strokes, seizures, but also really weird conditions with nerve endings, with spinal cord issues. They understand those things. So there are certain conditions where you're like, oh, I don't have sensation on both sides of my arms, or I can only sense heat and not fine touch. They know why people have headaches that seem to never go away. They understand the triggers for different seizures, and they can diagnose strokes like nobody I've ever seen. When those strokes or when those symptoms are so bad that they require intervention or repair, that's when you get a neurosurgeon involved. So while neurosurgery understands neurology, neurology cannot intervene the way that neurosurgeons do. Okay? So if there is a brain bleed, both of them can look at the image and say, this is a brain bleed, but only one of them can actually potentially repair that brain bleed. They see adults and kids. Usually pediatric neurologists or neurosurgeons are the ones who treat children specifically. As I said, the bread and butter are going to be those headaches, strokes, and seizures, meaning the most common things that you see. But neurosurgeons, they see tumors as well. So if there's a person that comes in and they have some type of cancer that is metastasized or moved to the brain, or they have a tumor that is just occupying space, causing the person to have conditions and neurological findings, they can actually resect or remove those things, right? if you've ever watched an episode of like one of these TV shows, the doctor or hospital TV shows where they drill holes in the head and release some blood, that's a neurosurgeon that does that. And in some cases, it's an ER physician, but we're not going to go there. All right. Ophthalmology. So my main man and fellow Morehouse alum, Samuel L. Jackson, here as Nick Fury with one eye. I think that ophthalmologists are some of the coolest people I've ever come across. And I think it's mostly because to have such an interest in the organs that allow us to see, that allow us to perceive things, it takes a special person. The other part about it is there's an entire different language that they speak, like literally. If you've ever talked to an ophthalmologist or seen an ophthalmologist notes, it's written in a bunch of shorthand and stuff that if you weren't an ophthalmologist, you would probably have trouble understanding what it said. But their job is to understand all things eye, all things related to the eye, from external to deeper in the neurological processes that are involved with eye issues as well. They have the entire spectrum of things. They can work in the clinic, they work in the OR, and they can go to the operating room. They have very, 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 very good hands. And I say that because in medicine and even in dentistry, there's a distinction among people who have good hands and bad hands. Usually your surgeons and people who do procedures need to have good hands, like steady hands, good fine motor skills. Ophthalmologists have great hands. And then I would say that it's highly competitive. So remember I said plastic surgery, dermatology, right underneath that, ophthalmology. Because mainly their hours are pretty good. You know, you'll see people in the daytime. That's the first thing. The second thing is you usually don't have to do a whole lot of call shift, which means covering a hospital when in the like in the after hours or over the course of a day. I think get paid very, very well. So ophthalmology is something that I think most people, oh, and let me just add this. I think there's less than 2% Black ophthalmologists in the US. So think about that. If you're interested, like that's how rare it is to find a Black ophthalmologist. All right, orthopedic surgery. Now this is what a large percentage of you people came here for. We had an ortho surgeon on earlier, and I'm sure he will attest to how cool of a specialty it is. It is one of the most popular fields because most people understand the nature of the injuries, but it doesn't stop at just thinking about an athlete getting hurt. It deals with anything in the realm of bones, joints, tendons, ligaments, but they also deal with traumas. They also have really good hands. And so I want people to understand, like, it is not just what the colloquial term is, the bone doctors. They are the bone doctors, but they are also surgeons. So you have to respect them as such. I can see children, can see adults. The cool thing is that they do a lot of manipulation with the hand. So things like placing a cast. Who knew placing a cast was so meticulous? You know, getting the right angles, looking at an x-ray, matching up the bone, making sure that there's proper alignment so that it doesn't grow back funny. And then also understanding the right ways of doing things to not add more injuries, right? But they also do things like, you know, if a joint has an infection in it, they can wash out that joint. They can extract things from that joint. I've seen them manage very, very bad bone disorders. I also think that you have a lot of potential as an orthopedic surgeon to do things like be a team physician, and the possibilities or opportunities are endless because of that, right? You can work in collegiate sports, you can work in any of the sports. They all need someone who has this knowledge, and they get paid well. They will be on the golf course right next to your anesthesiologist. I do believe that the anesthesiologist will be better though. All right, we're on to the last couple of slides. Otolaryngologist and ENT. So this is an ear, nose, and throat doctor. All of those that I can't break down the Latin in that word. I think it's Latin. It's either Latin or Greek. I think it's Latin. But I see ENT anytime I look at otolaryngology. This is a cool field because they do a lot of stuff with scopes, right? So these are very small spaces that you look at a person, like we're looking at Kendrick Lamar right now. I can't see up into his complete nasal passage or in his mouth, but an ENT can come with a scope and then look down into those spaces and can see if there is a polyp, or can see if there is an obstruction, can see if there's swelling, and they can then pass things through to help improve those airways. But they also deal with things like people who have recurrent earaches, ear infections, loss of hearing, difficulty swallowing. All of this stuff is in their wheelhouse, and it makes them extremely valuable. So very well compensated, probably in that list of extremely competitive things as well, and can work in a variety of fields or settings. Pathologists. So we're getting into the spectrum of people who I would say like are not really, really happy to see a bunch of people, but rather see people in the form of their cells, in the form of their the things that are sampled and collected, right? So samples of body tissue for diagnostic forensic purposes, that is your pathologist. If you ever watch somebody say, oh, send this to Path, send this to the pathologist, they're talking about someone like this. So there's often several opportunities, not just in the hospital where you're diagnosing types of cancers or benign tumors, but also where you're looking at samples and saying, hey, I think that this sample matches another sample. It could have come from a person who committed a murder. It could have come from somebody from 20 years ago, and we've now solved a case. So this is where pathologists come into play, except they are also doctors. So don't get the DeVry pathologist and this pathologist confused. All right. So the person who's like a crime scene investigator is not this person. Usually stay in the lab. That's where they're at. Right there with microscopes and assays and all types of other cool things. All right. PM&R. I'm going to start to put this on speed because I think I'm down to another 3 minutes. PM&R is about trying to get somebody's range of motion back to where it once was after some type of major injury or condition that causes them to have a reduced amount of range of motion. They want to restore a person's ability and quality of life. Usually see people in the clinic, they don't go to the OR and don't have wards, and you're usually around adults. I think that they get paid extremely well because imagine not having the ability to do something after a major collision, a car accident or something like that. You would almost pay as much money as you can to be able to walk back again, or walk the way you once did, or run the way you once did, or perform the way you once did. And they are usually tasked with creating that regimen to get somebody back to their normal self. Plastics. So I know y'all like these pictures I pull up. Plastics, it is a cool field. Most people think about Brazilian butt lifts and tummy tucks and different type of repositioning of things, but they rarely think about the patient who has been burned or scarred severely and needs skin grafting, or the person who has severe tendon damage in their hands and used to play piano and they need someone who can help them get that alignment back to whatever or preserve what could be left. I think that plastic surgeons not only beautify, but they try to restore, and they can reconstruct things. They can use parts of the body that we never thought about using to build stuff. So there is an element of creation here in sculpting. Extremely competitive. We already know why. That's why you got a bunch of them in Miami that are just balling. They get paid well. And I think that a lot of them have the ability to do multiple things like run a business because it kind of cuts out the overhead for some of them, and it allows them to control more of what they earn. So I think that this is a pretty good feel for somebody who has a business mind, has good hands, and is interested in trying to be creative and help the body reach its optimal condition. Psychiatry. Everything with mental and psychological conditions falls under this field. I want you to know that there's a difference between therapists and psychologists and psychiatrists. Psychiatrists are able to prescribe medications as well as see longitudinally how those medications interact with the patient to see a good outcome. They also are able to see people acutely and determine if they are having psychotic breaks, if they are having any type of suicidal ideation. They have a lot of other medications that they can prescribe to help intervene. Usually, they have very flexible hours, can set their own times, and because they can get paid by the hour and set those rates, they end up being very well compensated. Oh. All right, I think I got two more. Radiology. This is the field for anyone who's like, I want to listen to music in a dark room and look at pictures. This is, to me, I like seeing people, but they see people differently. They see people from their imaging. They see people from when they notice something that is irregular, and then they can tell you exactly how it is. Usually learn a lot about a patient when they call and they tell you, I saw this, so tell me the backstory. Radiologists are needed. Every single specialty needs a radiologist. All right, so that's what I would say. They are in demand, and I don't ever see a situation where radiology is going to go down. Second thing about radiology is you don't have to be at the hospital to do it. So right now, everybody's on these Zooms. This is how radiologists lives. They've been looking at screens for a while. They could be literally in another country reading x-rays and reading CAT scans and MRIs. So if you like to travel, if you want to have that flexibility and want to work from home or work from somewhere where you can be remote, this is your field. But you'll also see a lot of things. You know, you look at pediatrics imaging and find a mass. You'll see a person and diagnose them with something that looks suspicious for a brain bleed. So be also able to understand that they deal with some severe issues as well. Last two, general surgery and urology. Your general surgeon, this is a person who can use, when the body cannot be cured through strictly medicine and giving prescription medications and needs some type of operative management, this is who you call. A lot of times they are doing intra-abdominal procedures, but can do washouts or can do fasciotomies, which means like opening something to relieve the pressure. I think general surgeons are also pretty versatile in terms of what they can do. They can then subspecialize. So you can be a thoracic surgeon, a trauma surgeon, a cardiothoracic surgeon. You can work on specific body parts, right? And I think that they have a wide range of knowledge because not only do they work in the OR, they also manage patients on the floor. So you'll see patients in the operating room and see patients who are admitted to the hospital at various levels of care. So it requires you to be pretty intelligent. They get paid well. And for the most part, it's like whatever procedure you do, you bill for. So the more of them you do, the more that you can bill for them. And urology. So here is a picture of Thanos. He is holding an infinity stone. That is how I view urology. They are searching for the stones. So usually when I talk about stones, we're like kidney stones, right? Everybody's heard of these things. Are super painful. People talk about them in terms of like as painful as like childbirth being the most painful thing people can think of. Having a stone and passing a stone is like probably 1 degree or 2 degrees beneath it. But they deal with the entire genitourinary system. So anything bladder, kidney, ureter, urethra related. I think that people mostly see them as male dominant things, meaning like dealing with vasectomies or problems with how the urethra passes through stuff. But they also, I mean, many women have urologists too. So if you have recurrent urinary tract infections, you might need a urologist, somebody who can help figure out why, and if there needs to be any type of procedure to improve that passageway, then they can proceed and do that. And they get paid a lot. All right, so down to my last couple slides. Lastly, I would say know that each one of these fields we've talked about today, these specialties and primary care fields, has an element of these sub things outside of the box. So this is me saying you can be a doctor and have an interest in multiple other areas within that specialty. So take a look at some of these things and consider them on your slide set. So now I gave you the landscape. What do you want to do? Think about that.
Thank you, Dr. Brown. That was wonderful. We will now, if it's okay with everyone, take a few questions that have been sent in. Let me see if I can get some of these down. Okay. There's a question from Aaliyah. Do dermatologists deal with burn survivors?
Yes. Dermatologists can deal with burn survivors, usually the cosmesis, meaning like the cosmetic element of the burn after the fact, but you're most of the time dealing with a plastic surgeon because of continuity. So plastic surgeons also feel a great degree of responsibility for burn patients. In most hospitals, the burn unit is staffed by plastic surgeons because they have to not only manage the way that the wound heals, but to make sure the patient is adequately hydrated. And there's a bit of medicine that needs to be done. That's what I'm saying. There's a bit of medicine that has to be done as well in the circumstance of an acute burn. But long-term management of a burn, I do think that dermatology can be brought in and talk about certain skin emollients and ways to manage that burn so that it has a better cosmetic finish. But they're not going to do any procedure to correct it. So understand that they're not going to do something like a skin graft or, you know, some type of revision of an already existing graft. That's usually a plastic surgeon.
Okay. Another question from Antonio. If you qualify for loan forgiveness, how much of your debt would be relieved?
That's a great question. You said Antonio?
Yes, Antonio's good
so
question.
So while you guys saying the names, I'm like swooping over to see Antonio's face.
Right.
At any rate, so Antonio, I see you. I got you. All right. It's not, his face ain't on here though. All right. Antonio, that depends, right? So usually I want to be very clear. There are not, what's up, Antonio? Waved. All right. There are usually very few instances where 100% of your loans are forgiven. A few of those ones are, I would say, military. So if you went to the armed services or some sort like that, they do loan forgiveness in the form of service commitment. So you work, however many years you work, you want forgiven, that's how many years you need to work in service, like as that doctor. So not just basic training, but like basic training, and then you become a military officer. You come in at the rank of an officer, and then you provide service as a, let's say you want to go into surgery. So you're going to be a surgeon for 4 years at a military base for 100% forgiveness of the loans, right? Most programs, like the really, really good ones, there's one called, dang, I can't think of it right now. My mind's in 1,000 places. But the most common ones are the government-oriented ones, and they do a percentage of it, right? So you can have like something like 80% is the highest. Most of them are around somewhere like 60 to 70%. Sometimes they give you a lump sum, and you apply that lump sum to your loans, and you can renew it. Then there are research-based ones. So if you perform certain, like if you are an internal medicine physician, go into oncology, like the study of cancer, and then you do research, like clinical research, they have government agencies that will cover a large portion of your loans while you do the research. So to answer your question, it varies. The main thing you need to know is that, one, this entirely could change in a matter of a year. And I know that's crazy, but you've seen what can happen in 8 months. So I'm saying that in the course of a year, the amounts of loan forgiveness could change based upon the presidential administration. And two, that a lot of these loan forgiveness as a state-based thing can change. So some states like California have loan forgiveness based upon what communities you work in. If you work in somewhere where they have a lot of people who are underserved or underinsured, they give you certain percentage of your loans forgiven. So hopefully that answered your question.
Thank you, Dr. Italo,
Yep.
for that. A couple of things. If you, Antonio, send me an email at dob@pmfmd.com, I have some additional actual information on that, and that'll be a reminder, and I'll try to shoot that out to everyone, okay? Okay, this question is from Deshaun to Dr. Brown. Great question. Can you speak a little bit more to the differences in patient interaction / continuity of care in the different pathways? For example, family medicine or anesthesiology.
Got it. Okay. So the term continuity of care refers to the ability to see somebody longitudinally, meaning transition from their first initial interaction with the healthcare system to seeing the same provider multiple times, who has the same level of access to the records and knows the patient. So to kind of paint that picture, I work in the emergency department. If I'm seeing the same person over and over again, that is a problem, right? I should be seeing people for the first time and hopefully the last time, but you may see them again. Continuity of care would be, you are a pediatrician and you saw that child when that child was 2 years old, 3 years old, 4 years old, all the way up to the point when they were 21. All right. So there's a continuity. That person can say, hey, I've grown as a physician with this child. I've seen this child go through a lot of different things. So I know that this child had, an allergy to this medication when I gave it to him because I saw what occurred. I know that this child, comes from a certain type of home. That is why continuity of care matters. Now, it feels like anesthesiology, again, they don't have a patient panel that they go back to and say, oh, this is the 700 patients that I've seen and that I'm seeing this year, I'm responsible for. Their continuity of care is mainly within a short frame of time. So from the moment you check in to get ready to go to you're going to get a procedure done, to the moment you check out. And then most of the time your follow-up is not with anesthesia, it's through whatever service did the surgery. So continuity of care is probably more specific to all your primary care fields, to general surgery, because you have patients, for example, if I do a bariatric procedure, like if I basically put a band on a part of your stomach and help you lose weight, you have to follow up with me. I have to watch you. I have to see that it's working. I have to make sure you're not having complications. So there's some specialties that have that continuity of care, like general surgery. I would also say ophthalmology has a degree of continuity of care. If you're somebody who has a serious ocular condition and you have to see somebody multiple times, dermatology can have some continuity of care too. But for the most part, we're talking about the primary care specialties who are managing multiple issues longitudinally through the course of several years. All right, cool. We got any more questions?
Oh, okay. So we have a lot of questions. So we only have time for one more.
Okay.
What we'll do is we'll try to get answers to some of your questions. So I'm just picking one. And this one here is from Kobe Miller.
Mm-hmm.
Having an M.P.H background.
Dope.
You
Yes.
find that degree is helpful in the emergency room and so forth?
Yes. All right. So I'm glad that you brought that up. I am a champion for public health. I believe now more than ever, you're going to see a vested interest in public health. As you can tell, we have dealt with what is considered the largest public health crisis of the last 100 years, as well as the fact that we're on the brink of vaccine conversations, which is usually a public health, like that is our finger roll. That is our layup. That is our free throw. We love vaccines. So with that, I say, as an ER physician, public health has been like extremely useful for me. And I went the route of going through public health before I went into medical school. So I was already sold on public health and I had to be resold on medicine. With that said, as far as understanding the complete, the context of illness and wellness in America, you can't do that without having a basic understanding of public health. You need to understand that there are social things that affect the way people actually live and their ability to get optimal health. Things like lack of access, lack of education, poverty, I can go on and on and on about the social conditions that cause people to have worse health outcomes. So that understanding and ability to track it is a part of public health. The ability to create interventions and strategies that improve these issues are part of public health. And physicians, people who specialize in being evidence-based and love to try to do the best thing for their patients, have an interest in public health. The two top ways that I can think about, and ways that will appear on exams from now until forever, once you become a physician, is understanding of epidemiology, which is the study of disease occurrences and trends in a general population, and then biostatistics, which is the ways that we can create data to support those trends or to evaluate those trends, right? We make our distinctions based upon, like, every single research article that has to be read by a physician is built on two of the major concepts that you learn in public health, right? If I get a paper that's saying, hey, you should use this medication as opposed to this medication, well, what's helping me make that decision? I'm looking at data. I'm looking at ratios, the odds of it working, how many people improved, how many people got excluded from this study. All of those things are skill sets that you learn in public health. And so that's how I find it most helpful, is because I can break down data and understand the evidence for myself. I don't need somebody to just tell me, throw this medication down. Hey, give everybody Plaquenil for COVID-19. I read the study. I understand the data. I'm not going to do that. So.
Okay. Dr. Brown, we're going to try to do two more questions, maybe quickly to 10:50, okay? And then we'll take a break.
Certainly.
What is the difference between the emergency physician who is an MD versus a DO? If we could get a brief answer on that.
Yeah,
okay.
Wonderful question. Okay. MD, DO, allopathic medicine, osteopathic medicine. Allopathic medicine believe that we can use medications like pharmaceutical medications to heal the body and to make the body do certain processes that are corrective. Osteopathic medicine believes that the body has some intrinsic ability to heal itself, and manipulation of some of those things can improve the body, as well as medications that can assist the body in doing things. Bottom line difference, letters, MD, DO. When I step into a room and I see a DO, I feel just as assured as I do when I see an MD. Because in all honesty, I find that the DOs that I've trained with have to operate with the expectation that people are going to think that they are not MDs. And so they train very hard. They understand the medicine. And I think that more often than not, I find the DOs have had a variety of exposures. Not only do they do things like, write for medications and see patients and can do procedures, they know manipulation. Like, they knew physical manipulation, which means like ways that you can, certain positions of the body that might relieve pressure, might relieve lymphatic systems. So they have a realm of understanding of medicine that we do not train in allopathic medicine. But in terms of opportunities, I don't see a difference. I feel like DOs and MDs are both well respected.
Okay, another quick question from Zariah. Okay, can radiologists take the CT scans, x-rays themselves, or do they just examine the images?
Cool, great question. I like that. So the radiologists usually do not take the x-rays or the CTs or the MRIs. Those are usually techs. I'm sure at one point they did, but it became a process issue. And I'm sure that they figured out that it was more efficient to use the radiologists to do what they do best, which is interpret those images. And you can get an operator or a technician to do the physical work of running those machines. One thing that radiologists do that you did not mention, and maybe because we just don't consciously think about it, is they do ultrasounds, right? So an ultrasound is like a device that uses sound waves to create an image of things that are deeper than the surface of a person, right? So when you put it on the surface of a body, you can see a baby. You can put it on the surface of the belly, and you can see parts of the bladder. You can see the ovaries. You can see testicular infrastructure. And so when I need someone to do something emergently, those radiologists are trained enough to get the perfect images because they see them. They know what the windows and the views are supposed to look like. So they can put that ultrasound on a person who I think is having like a twisted ovary or torsed ovary, and they can view the flow of the blood flow to that ovary to tell me if it is being affected or not in an emergency situation. So with that said, there are only a few specialties that have the ability to use that device, that ultrasound, with that type of expertise. Radiologists are one of them.
Okay, and I think this is a perfect question to end on. This is from Joshua. Edic, I think his last name. What were the main drivers that caused Dr. Brown to go into emergency medicine?
I'm going to put a pin on that question because it is baked into my next 2 lectures. So I think that is going to be better answered as I present the portions around building a personal statement and the portions around interviewing.
Okay, all right, great, thank you. So that'll end our question and answer for this period. We'll, of course, have additional ones with the next 2 workshops. A couple of things I want to remind everyone is that if you complete all 3 of the workshop sessions, Physicians Medical Forum will send you a certificate of completion and some other information if you go through all 3. So don't forget that. We'll email that to you. And so now I think what we should do is maybe take a little break. Everybody can kind of refresh. Dr. Brown can refresh, and we can come back at 11 o'clock. Okay, thank you. Hi, everybody. I think we should move on so we can move to our next workshop with Dr. Brown. Are you there, Dr. Brown? Okay, great, great. It's a lot of talking. Sure you have to kind of freshen up and relubricate. I want to remind everyone, and I hope you all received the presentations, Dr. Brown's presentations electronically. They are also on our website. In addition, we sent the information from Princeton Review, both if you are applying for college or if you are preparing for the MCATs. That information is very, very important. So please, please review it. And we hope to keep you up on and add you to our other list so that other opportunities as they come up. The other thing I just want to remind you that PMF also, besides mentoring and networking and workshops, when we have the funds, we try to do scholarships and stipends and special projects and include students that are at least in the area or able to work on a special project and maybe provide them a stipend. So that's a little bit more about PMF. And with that said, let's move to Dr. Brown's next workshop presentation. Thank you.
So we talked about different fields in medicine, and it's kind of a broad stroke understanding of medicine, but we know that the reason why you're here today is because you're along the process of getting to that point. Like you are somewhere along that pathway, and that journey itself is unique, right? Every single last person that's on here has a story to tell, has some sort of narrative that makes them a viable candidate for being a physician. My job today is to talk to you about how to extract that narrative, how to get that story out there and deliver it in a way that is compelling. When they ask you to deliver a personal statement, what does that mean? So how do we find and develop that statement so that you can be as effective as possible in your candidacy? So again, I like to use images. What is a personal statement? Like, how do you describe it? And I mean, I can see that you can read this portion right here. I'll read it, but then I'll go a little bit deeper, right? So it's a written description of one's achievements, their interests, etc., included as part of an application for a job or to an educational program or anything of the like, right? But this is kind of a very cursory understanding of what a personal statement is. It is not just that. It is more so your narrative and a way that you articulate your desire to be something through your narrative. So I want you to understand that it is more so than just writing something that says, this is what I've accomplished in life and this is why you should select me, but more so who you are, what you believe in, why you're a good fit for that role, and how that's going to help you to fulfill some higher purpose or higher drive. All right. So when I think about personal statements, I want you to know that there is a certain depth to it, right? You can't just write these things. They have to be expressive. They have to have the ability to take somebody who's never known you and has probably 10 minutes max, if not, closer to like 5 minutes, to kind of learn about you. They have to understand who you are, where you came from, what your struggles are, what your abilities are, what sculpted you. That has to be articulated in the statement. Now, I say it's both subjective and objective. What that means is, in that statement, you have to give facts. Like, you have to give somebody truth and things that are verifiable, but you also can paint those facts and pivot them in a way that makes sense to you, right? So that's the subjective element. But the objective part is, it happened. You can go somewhere, you can see it. There's evidence of it. The part that most folks don't think about is, it has expert opinion, and you're that expert. That is why you have the greatest ability ever to write this story. No one can write it more perfectly than you can. And it's the preamble to you. That means that once I finish reading this statement, I should feel like I've been introduced to the world's greatest candidate. I should feel like I know you a little bit, like I could sit on your mom's couch. That's how I feel. It is the introduction that gets me in the doorway to say, hey, all right, I know this candidate a little bit. So think about it that way, and I promise you, you will spend the appropriate time trying to construct it. So we ask, like, how do people use these statements? For the most part, they are a requirement to enter any major field of professional, a professional career, right? Medicine, dentistry, law. I can't think of a specific field that when you're trying to get into the school, they don't require a personal statement. But on top of that, there's other uses for it, right? So if you have a scholarship application, they usually want to know a statement of purpose, or they give you a prompt and they ask you to, like, articulate your idea around something. And many people bend their statements to those prompts. If you're going to apply for things like submitting an application, submitting a publication, they may ask you to give a statement of purpose or some type of personal statement so that they understand the author, as well as when you are asking other people to vouch for you. So trying to get letters of recommendation from instructors, giving them a personal statement may help them better understand you and your intentions. So it's good to have these things. I use my personal statement pretty often. I've used it for speaking engagements. I've used it when trying to approach different boards. So I encourage you to build a statement that speaks to who you are and it's effective. But its major job is that it answers a question for people, right? They want to know why you want to do this. Why do you want to be a physician? We talked about it last time. I kind of mentioned it casually, but now we're really getting into the granular elements of it, right? How do I know that you'll be a good doctor? What have you done in life that tells me that you're in alignment with this profession? And how are you going to tell me that, right? The cool thing is, this story is tailored to you, and it can be as fine as and narrow as you want it to be. It's just more so an exercise in you figuring out what you're willing to share and be vulnerable with, and how you construct that struggle or that story or that narrative or that triumph to make the point that you would be a good doctor, right? There's a lot of reflection involved in these statements. So I say that especially now where we have to be very mindful of how writing and words pull our emotions and make us relive things. So think about that in writing a statement, you may drum up some things that you've kind of like stowed away for a while, particularly because that stuff may cause some pain, or because it may be unsightly. Now, it doesn't always have to be like a story about somebody dying, but sometimes it's failures that you've encountered that you're not happy to speak about again. But you have to bring that to the forefront because you want to draw a reader in. You want them to feel like they are reading something as captivating as a Marvel comic, right? But make sure that at the end of the day, you are goal-oriented in how you write. So it's not just about, let me take you through this really cool, J.K. Rowling story. I want to know at the end, what are you trying to do? You want to be a doctor. Why? Like, make sure you explain that. So I usually give this talk and I speak about the power of your narrative and how you can slowly craft this narrative that commands the attention of the reader. And these 3 bullet points usually help me to build that, right? Premise, anchor, pivot points. When you establish a premise, what we're talking about here is making sure that there is one takeaway idea or concept that lets someone know exactly the purpose of you writing this, right? I need to know why you're a physician. Have it in a very succinct statement. That is your premise, right? So if I was like, you give me a statement and I said, all right, I'd like to be a physician because I believe that through medicine, you can change the way that people think and interact with one another, and then ultimately improve the well-being of society. I just made that up, but that might be my premise. It's enough of a premise for me to say I can build stuff out of that, right? You have anchors. Your anchors are traits and characteristics that make you strong, that make you feel like you are an apt pupil or an apt physician. So those anchoring points off that same premise that I said, I don't remember entirely, but you start to think about things like being steadfast, being a good problem solver, the fact that you're good with your hands, you can communicate well. Like, these are anchors. These are things that you have, or you're compassionate, that make you a strong, that give you the DNA of a good physician. And then finally, finding those pivot points. So these are those inflection points in your conversation or in your narrative where they are a significant fork in the road. And if it wasn't for this particular thing, you might have gone left, but you chose to go right. Or there was something that had multiple decision points and you went forward. Like, these are pivot points, and they are like really the parts of a story that are like the turn. They give somebody a feeling that they are invested in reading it. So think about your pivot points. An example would be like, I was failing out of school, and then I decided to go see someone who helped teach me how to do a particular style of learning. And then I started to do well. That is a pivot point. Or, hey, I was working in a menial job, and then somebody came in and said I could do so much better. And then they gave me a biochemistry book, and I thought it was interesting. Pivot point. So think about those. Soft flexes versus hard flexes. I like, if you've ever watched Jalen and Jacoby on ESPN, they talk about boss moves, soft move or boss move. This is kind of my version of that. A soft flex versus a hard flex. So a soft flex is an indirect mention of a strength, right? So when I talk about soft flexes, well, let me start off by saying that you have to master the ability to do both in your conversation and as well as in your writing. Soft flexes and hard flexes are in the anatomy of being a self-advocate. And I say that because in most situations along this pathway, you're going to have to be a big advocate for yourself. And that means knowing how to do soft flexes and hard flexes. Let me take a sip of water. So a soft flex, an example would be mentioning that, I remember learning that particular concept while I was on the board of this biology organization. You know, you're not outwardly saying, I was the president of the biology organization. You're saying indirectly, like, oh, that was a really cool thing that I once saw and learned about while I was a board president. You know, so it is indirectly bringing the major point. The point that you're trying to make isn't that I've had exposure to this issue. You're trying to bring the point up that I was the president of this board. That is a soft flex. Whereas a hard flex is outwardly saying, like, I spent 3 summers as the chief TA for X, Y, and Z. And because of that, I interacted with hundreds of students. That is a hard flex. You're saying this experience is so significant that I'm not going to nuance it. I'm going to say it outright and lead with it because it has something to do with what I'm trying to prove. Both of them, if you learn how to use these masterfully, I promise you, it'll take you far. Acknowledge and address weaknesses with authority. So what I mean, not with authority, like to people who are more superior, but with authority, meaning like with a degree of commanding of those weaknesses, right? So people will always say, hey, you know, turn your weakness into a strength in a paper. Sometimes that is okay. Sometimes it appears like you're trying to make excuses for things. So I want you to be very savvy in how you navigate this. If you have a weakness in your history, a weakness in your application, do not leave it out. Like, don't just, because the worst thing that could happen is they find out about it and then they ask you, why didn't you say this? Or they feel like something doesn't add up and altogether they don't give you the opportunity to explain it. In your narrative, you can explain it. You can take the affirmative stance, the authority on it. You can get it out in front of it, right? And say, this happened. So think about how you can say that in a way that shows that you learned from your mistake. Not the fact that you made the mistake and you're embarrassed by it, or the fact that you made the mistake and you try to cover it up, but the fact that you made it and it became a learning experience for you. And out of that, you grew. So talk about that growth. So I got another picture here. It's an old movie named Boomerang. This is Eddie Murphy and a man who recently passed, John Witherspoon, and he's talking about how his belt matches his shirt and his shirt matches the insides of his jacket, like the lining, and he got all these different things, and he said you got to coordinate. And so with this, I talk about layering and coordinating, right, in building your narrative. Layering to me means with each successive paragraph, you're kind of adding on another layer of who you are, of your personality, of the things that you bring to the table. Like there is a continuity through it, and all you're doing is just like putting on more, so that it embellishes and creates a degree, like a complete aesthetic of who you are. And coordinating it means that you can't just bring some things that are arbitrary to the table. The things that fit in this narrative have to make sense. So don't just layer on something that doesn't match. Layer on stuff that matches. Put the belt with the shirt with the liner, and all of it have the mushroom pattern. That's coordinating. So that's how you have to think about it when you're writing. And then there's the boomerang effect. Hence why I use the picture of the boomerang. Everything that you say has to boomerang back to either an anchor or a premise. So as you're constructing those paragraphs, the sub points that you make, the experiences that you're using, they should boomerang back to one of those things that you're trying to draw out as major themes in your writing, in your personality, in your narrative. So I'll use some examples of those things just quickly. So an example of layering and coordinating would be if I'm telling you in one part of the statement that, you know, I like to do service. I like community service. And I start off by my first paragraph experience is talking about how I worked as a child. I worked in my church to help the elderly. And out of that, I grew more interested in working with people and seeing the illnesses that they had. Then in the next one, I layer and coordinate and say, well, then as a college student, I started an organization that started to do these food drives, and we would often go in the homes of elderly people and da 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 da. You see what I mean? So layered and coordinated. It built upon a premise. And the boomerang effect is that each one of these, you're hearing me talk about serving somebody other than myself. And so if my anchor is I am a servant, a leader, a servant leader, then that means now that in each paragraph, I'm talking about either a leadership quality or my ability to serve. That is how you kind of craft that concept. All right, so these writing structures I like to talk about, because for most of us, we don't like. I'm cheating. I'm gonna tell you right now, I'm cheating, because my mother, my mother passed, but she was an English professor, like English teacher, not a professor. She was a high school 9th and 10th grade English teacher. And so that is around the time when people have to start doing more complex writing in general. And this is what I've lived most of my life understanding, was like these writing structures and how to write. So there's a natural, this conversation is extremely natural to me. So I'm telling you that when I break down these writing structures, it's because, not that I assume that you don't know it, but because I understand that for the most part, we don't put words and phrases and things to define it. We've seen it and we've been exposed to it, but we just don't know it that well from a literary sense. Okay. So I'm going to go ahead and start talking about some of these things. Cool. All right. Hold on. That's perfect. So the first one is going to be prompt, statement, support, and restate. This is a very easy, I would say, most common way that people do this. Their job is to say what happened in the prompt, like take the prompt, make sure that you come up with a complete or cohesive idea, like a thesis, and then provide support around what you think, and then restate what you said in a way that seems like it's succinct. So an example would be if in the prompt it says, like, explain why you believe that you are, how your role in medicine will advance care for the future. And then your statement has to answer that. Then you build support in your body of your essay. And then finally, you restate at the end what that prompt is and how you're going to weave it together. So most people like to use a variety of things to do this. It can be a quote. So you can lead with a strong statement. Right now, just to let you guys know, if you're writing statements, a very, very good quote that people have been throwing all around is about Good Trouble from John Lewis, the representative that passed, who is a civil rights activist. His quote on Good Trouble and Necessary Trouble, you've heard stated multiple times, especially if you paid any attention to the talks of this past week, right? So think about those quotes. You can lead with that, or you can lead with an anecdote, like a little small story, but don't make the story half a page. Yeah, an anecdote is specifically a small story. So think about that as ways to lead in. The other thing is that statement has to be affirmative, right? So not passive. If you know what I'm saying, let me see you do a thumbs up between affirmative and non-affirmative. Okay, so I see some heads shaking. All right.
Thumbs up.
Perfect. Thank you. Man, dog, if you talk to me, I talk back. All right. So affirmative is a tone that sounds more, I would say, sure of itself. So if I told you we were looking for something in, let's say you asked me, Italo, I'm thirsty. What do you got to drink? And I tell you, there could possibly be something in the refrigerator. That would make you want to say, I'm cool. I'm going to go and get me something to drink somewhere else. But if I said, look, I have an ice cold Coca-Cola waiting in the refrigerator for you, that is an affirmative tone. I've said it directly. So now let me do it in terms of a writing statement. If I said in my statement, the reason why I would like to be a physician is because at the end of the day, I believe that I may be able to help as many people as possible. It's a whole lot of mights and maybes rather than saying, I believe that everyone has the capacity to care. As physicians, our job is to be leaders in that. And I identify strongly with it. It's an affirmative statement. I'm not leaving anything up to question. I'm telling you where I stand, what I believe in. All right. So that is how you have to think about affirmative tone. And at the end, you just recap it. Cool. Let's keep it rolling. So second structure is what I like to call the Marvel structure. I'm going to start naming these things. Like the first one, I would call it probably like your essay structure, standard essay. The second one, I would call it a Marvel, right? Because I don't know who in the world does not enjoy Marvel movies. I enjoy them to the nth degree. I'm talking about like anyone, any era of Marvel, I've enjoyed it thoroughly. And I think that most people enjoy it because of its classic story arcs. Like we love the origin stories. We love the way that they create this huge character arc and they pull people in and it like weaves in at the end of the day. It's like, oh, this is super sad and amazing at the same time. And I'm cheering for somebody. I don't even know why. Right. So that is what this way is. It's using the classic story arc, right? Setting, rise, climax, fall, resolution. Every story we've ever heard from the beginning of time has had these elements, right? Setting, rise, climax, fall, resolution. Think about it. Any one you're talking about, Icarus flying close to the sun has those same things. Garden of Eden has those same things. Like any major story that you've ever heard of. Let's talk about Iron Man, right? Iron Man setting. Bratty kid grows up, dad dies. He feels like he hates his dad. And all of a sudden starts becoming a billionaire playboy. Rise, he gets really, really good at what he does. And then all of a sudden he gets kidnapped. And then in this period of solitude, decides to fight for something nobler than himself. Climax, he becomes a superhero, literally saving the world multiple times. Fall, they disband. He faces enemies that he can't do anything around. Resolution, he gives himself up. Sorry if I spoiler alert to anyone who hasn't seen the movie. My bad. But it's actually your bad if you haven't seen them. So I'm not going to be sorry. At any rate, the resolution is how that ends out, how it plays. And you can think of your life similarly, right? And every resolution doesn't have to end in some type of like tragedy. It can end as I've accomplished trying to be the person that I've always aspired to be, or I've come to the point where I can write confidently about my failures and still work through them to be the type of doctor because I know my patients are going to struggle and I know what that feels like. Like, you know what I mean? Like you have to be able to write these things in a way that are compelling. So major points, as I said, consistent story and plot is throughout that thing. And you arrive at the resolution that kind of has this ability to solve a question that the reader is having throughout, right? You want to know where this person is going. You want to know the story. And that resolution brings closure to it. And they leave feeling a sense of completion. All right. Third one is, I call it 3 major qualities, examples, and synthesize. So this is probably what I would consider for me, the easiest way to approach a personal statement. Identify 3 things that you like about yourself in the context of being a physician. 3 things that you think that on your worst day you could bring to the table, right? And then figure out how that makes you a good clinician, how that would make you a good physician, right? And now think about your examples in life where you've shown those characteristics. At the end, talk about all of them together, weave them in. So the opening, as I said, it usually talks very blatantly about these qualities, and they're large qualities. So they can't be things like, I am smart. Like, that's not going to help. Like, everybody who's writing this thing is smart. Everybody on here figured out Zoom in the last few months. So we all smart. So I think you got to be more specific about qualities. I would give you an example. Like if you said, I am the type of leader who leads by example. So that is a very huge quality, to lead by example. I am an active listener. I mean, you listen to people's problems, you listen to patients, you listen to all types of other stuff. And then I'm proactive. I'm a self-starter. You don't need to tell me to go, I go. All right, I have my own motor. Those three things you can build an entire statement off of. And then you bring life examples in to explain where you have these things. And at the end, you can talk about all three of them interchangeably to bring about one cohesive idea. The body that you're supposed to do is your entire chance to cite those experiences. If you're going to tell somebody you're proactive, you better have 2 to 3 examples of where you just didn't need anybody to tell you to do something. Please don't turn in this the statement late talking about you're proactive. So keep that in mind. But I think that this gives people a better skeleton to work with, because most of you all have already thought about a few things that you do pretty well. And you know enough to say, if I said this on a statement, they would be interested in it. The cool part about it is it gives somebody literally, it's like a slow pitch for an interview. If your entire statement is about 3 things, they're going to figure out a way to investigate more about those 3 things. And you can just prepare yourself to know those 3 qualities and various examples of those 3 qualities. So I would say, like, there is more corollaries between how you use the statement when you're taking 3 major qualities and how you present in real life. All right. At any rate, bring them all to a boil, serve up the dish. This is me. All right, pro tips. So this is where I kind of get into the things that I think are where people, this is every last person on here can write. Let's get that out the way. You can write, you're capable, and you have an ability to share things and emote or express yourself. What we have to work on, and what I'm hoping to do, is to give you ideas and tips and tools to make sure that you whittle yourself down to being like literally a specialist in that. All right, so pro tips. I look at people's applications who did it. When I was in this, I was like, show me your statement. Not because I want to copy it, but because I want to see what it looks like for somebody to write one that was successful, that actually led to the desired end result. So get somebody that you know of who's made it into some type of a program with their statement, and then break it down. You know, go through it like you're watching game film. All right. Speak with a health careers advisor or person who serves on an admissions committee. This, to me, is if you have the access. And I'm going to blatantly say right now, when I first made this PowerPoint slide set, it was pre-COVID. So a lot of this stuff has changed to a degree. What I will say is that I think that it might be easier to access these types of advisors now more than ever, because you can do it virtually. So you don't have to wait outside nobody's office like I used to have to. You know, you don't have to sit there and schedule no appointment and be sitting there and be like, all right, man, 10 minutes. I'm gonna wait 10 more minutes. Nah, you can literally just pull up on them on Zoom. All right. But ask them to be critical when you talk to them. Like, ask them, they've seen hundreds of these things. Say, yo, be honest with me. Like, what makes you want to read these statements? What does a good statement sound like to you? So get feedback from them. And it's like getting it straight from the horse's mouth. All right. Steer away from internet advice. Now, I know who I'm dealing with in here. I'm looking at all the team members. Everybody in here is locked in. My brother that's got on the gingham check pink shirt with the bow tie. I mean, with the regular tie. Right. Have you ever looked on the internet at like what people are saying in these chat forums or whatnot about getting into medical school? right? And sometimes you read something and it seems like it is so far-fetched. You'll be like, oh, they like their statements to come from this perspective, or they like X, Y, and Z, and they're telling you advice, but no one can verify it. No one can verify if what they said worked. So I don't necessarily trust internet advice for things specifically in processes that are this competitive, because what you're going to find is there's a lack of consistency and no one is willing to risk their career on it. You say, hey, if you really believe that your advice is that true, put something up. Prove to me that it was actually worth something. I stand behind everything I'm sharing with you today. So that's why I say, like, you got to be like very critical of internet stuff. And then finally, this is the part that most people don't want to hear. I'm sorry. I'm going to be straight up with you guys. I even to this day struggle with reading books like for leisure, but you got to read. It sounds so simple, but you got to read. It can't be like, yo, I'm reading Instagram quotes. Like, it's not going to work. You can't be like, yo, I've checked out, a couple blogs. Unless those blogs are written by people like Ta-Nehisi Coates, unless those blogs are written by people who write for The Atlantic, you probably are not giving yourself the best access to, like, I'm talking high grade, elite level writing. You don't have to be an elite writer, but you have to be able to like distinguish elite writing. You have to know how they use their tools, because people who are writing books, they have to get this book published. They have to pass it through multiple sieves and filters. And somebody who has got way better ability to write and read and edit is going through their stuff. And you're like, yo, it took how many rounds for you to publish this one piece of work? So read the book, understand how they build their stories, understand how they craft that statement or whatever they're trying to make. And it gives you an idea of how you set up things, right? One of my favorite authors, Malcolm Gladwell. Every one of his books has the same anatomy. He starts off with some crazy story, and out of it, he pulls out like 2 or 3 moral premises. And then he uses the rest of the book to craft more support for these moral premises. And then his last chapter is usually extremely personal. And then he brings it all together. And then you finish the book and you're like, man, this dude's so smart. And at the end of the day, you're just talking about a dude who spends his time talking to people and hearing their stories. And he tells them to us. So reading his books give you, and I'm not saying that you should go purchase a Malcolm Gladwell book. I'm saying that you read something. You read something that's been published, or you read an article, an op-ed, to understand how to craft writing. It helps you to understand how to use your tools. All right, cool. So timeline, this is super important, y'all. This is one of those, I would screenshot this. All right, start early. And I know that's super difficult to do, but I'm telling you, like, it doesn't have to be a whole draft when you start early. It could literally just be a brainstorm, a web brainstorm. Like, I love to do, the little make a circle, put an idea in the middle, make some little things from it. I learned that in probably 5th grade, 6th grade. I've been doing that as an adult. Every time I have to come up with an idea, I start with like this little web diagram, an outline, something. Start with that. Go back to it. Write a little bit more. Fill it in. Eventually, you'll see the body of something, right? That the first draft that you do, there's a, what do you say? There's a movie called Finding Forrester. Came out like in the early 2000s. It features Sean Connery and this dude named Rob Brown, who also played in Coach Carter. There's a quote in this movie where he says, you write the first draft with your heart, the second draft with your mind. And it always stuck out to me as something that was so profound and super simple. So when you're writing with your heart, you don't care what you're saying. You're just saying it. You're just getting out as much as you can. So you write that first draft with your heart, and then the second draft you write with your mind. That's when you go back and you say, all right, this don't really make sense. Hey, the subject-verb agreement is not really here. This is a fragment. So you can start to put those things together in the second pass. But that first pass, just get it out, man. Get something out. All right? Main thing is you got to give people time to do reviews and edits. If you send me an email like, hey, so I was wondering if you could take a look at my personal statement. It's due in 3 days. I'm going to tell you, good luck. good luck. If you understand what my days are like, I probably would not have time to do that. But if you give somebody a 2 weeks time span to review something, they're going to give it a full read, and they're going to carve out time to go through that stuff. Plus, you give yourself a buffer. And no one ever said that you have to give the revised version you can only give it to one person. So what I tend to do is I will flood 4 people that I truly trust and say, hey, you got 2 weeks, give me some edits. And that'll give you an idea of what people think of it. That second draft, though, you got to come through with the knife and start chopping that thing up. You got to whittle it down to something that looks like a little bit more shape, a little bit more form, and it should feel like it flows better. Every draft thereafter is about fine tuning. It's having that engine that you know has horsepower that can really, really rev up something, but you want to make the timing right. You just want to fine tune just a little bit and start thinking about how you can pull out stronger pieces from or use words that make things come alive. So that's what you do in the subsequent drafts. And then finally, you want to have that last draft ready a month in advance before you submit. And that's because at the end of the day, people always go back and be like, I want to read this thing again and change a couple more things. Give yourself some time. But when you submit and submit with a good heart, saying like, I gave this my all, I did the right thing, did it the right way, and I think they're going to feel it. Feedback. All right. So as you can tell, this picture is the epitome of when people don't appreciate feedback. So here's the thing. In medicine, you got to have tough skin. There's going to be points where people are telling you that you didn't do something right, whether it's a patient, whether it is an attending, whether it is a colleague, whether it is a senior, or someone more senior. And you have to figure out how to take that criticism and use it and incorporate it in a way that makes you better. So don't be mad when that thing comes back to you with more red marks on it. And then literally it looks like somebody came through and tagged it up, right? You have to just embrace it. I've obliterated pages, but I have done it because somebody has obliterated multiple pages of mine. And it made the writing better. The first time I had a statement, I remember I started with something, the dude literally wrote in the margin, "What is this?" Like, what there wasn't like it wasn't in grade school in elementary you learn about how to edit things where they use 3 lines to mean uppercase this and slash to mean lowercase that, and then you circle this and draw a line, right? It wasn't none of that. It was just, what is this, and a line pointing with the arrow, and it was like the whole paragraph. What is this? So I took that and it essentially became, it was like 2 words out of it that actually were useful. And he said, that's all you needed to use right there. So sometimes you just write to fill words on a page. And he was like, you're not speaking to anybody. So think about that. Accept the criticism. But the criticism shouldn't just come from people who just read don't come from a place of authority when they read. You want folks who are good at reading and who can read quick. I don't know if you know anyone in law school. They are the fastest readers I've ever seen in my life. Literally, you give them something, you give them 8-9 page document. They've gone through it. They've read it in like 6 minutes. Like how do you read it and retain it? I have no clue. People who are in fields like journalism, if you know someone who's a journalist, have them read your stuff. If you know someone who is in copywriting, meaning they look at stuff and see if the words are the appropriate words to convey an idea, they're great at having read your pieces. And then basically anyone who is in a graduate school program who has to write as a part of the program, they'd be excellent. Major thing that I would say is you want to be selective about what you choose to go with. Just because somebody doesn't agree with what you said in a statement doesn't mean you have to take that advice. You can actually be like, nah, I'm gonna keep this. I like it. So you have a handful of those cards that you can play at all times where your ultimate say goes. And if you like it stylistically, then they're gonna have to love it. And then finally, just be mindful of your timeline in terms of incorporating feedback. How am I on time, guys? Oh, all right. Well, I guess I still got time. So I am going to take you guys through a couple examples, right? If everybody has this on their screen, I want to take a minute, however many. So I hate reading, and I've read out loud before. I was one of them dudes that was, the brown dog. Like, that was me. So I understand if you need a little bit more time. So take a second and read this statement. All right, cool. Okay. You guys with me? All right. Let me see if I can change my view for a second. I'll start looking at my participants because I'm going to ask somebody to read something. All right. Okay. I can't see names. Sometimes the people, I don't see the name of the people on here. If your video is up, it's okay. So I have there's a brother that I have here with a pair of glasses and a full beard. And yep, him. He just smiled. All right. What do you think is wrong with this statement? Give me one thing. Are you able to unmute yourself, or do they have to unmute you? I hear you.
Fairly generalized, I believe. It's nothing very specific.
Excellent. So generalized, not specific. He's saying that this particular statement seems to be very cursory. Okay. I have another person who has, all right, I'm going to go with, has on a white top with black rim, kind of like neckline. And yes, you. Exactly. What's wrong with this statement?
I feel like there are a lot of words that don't need to be in there, just like big words they threw in.
Which ones?
The thought of processing, the ability, like all that doesn't really need to be there. Tremendous internal gratification, that's like 3 words you could use to say, like you could use 1 word to say all that. I don't know, there's a lot of big words that don't need to be there.
Exactly. So the thought of processing the ability to help others, why not just say the ability to help others? Thought of processing, what does that even mean? Right? The thought of processing the ability. What? All right. Tremendous internal gratification. So the thought or the ability to help others, or I find joy in helping others. Extremely concise. This is what people aren't saying is this is a run-on sentence. You see that? Upon considerable reflection, the thought of processing the ability to help others provides me with tremendous internal gratification and offers the feeling that my life's efforts have been focused in a positive direction. It's a long sentence. It's like 4 ideas in there. They could either break them apart or say them concisely. All right. What else? Let me see if I got somebody else who jumped on. All right. All right, so there are 2 people with glasses. One has like a pearl necklace, it looks like on, and maybe a greenish top. Just kind of gave me a grin. Yes, you just adjusted in your seat. Is your microphone working?
Yes.
All right, cool. What do you see in here?
I feel like the beginning, the way they like rephrased the question wasn't very like appealing, or like it didn't connect to the reader's attention.
I agree. So, I mean, it's not really captivating. It's just a regular statement. That's what my man was saying in the beginning. It's just general. And so this is why it's a bad statement. It's for a number of reasons. Yeah, it's just not a good statement. Initially, there was a typo in here, and I don't think I feel like the program self-corrected the typo, but it, like it was supposed to say physician. Becoming a physician was spelled incorrectly. So that was going to be the other thing, that there was a spelling error. All right. Also, improper use of punctuation. Becoming a physician is the culmination of a lifelong dream. Why are we putting, I think this is a colon, right? Colon, the semicolon, one of the two. And I am prepared to dedicate myself as I have in the past to achieving the goal. There is a complete change in sentence, right? So you can just put a period there, or you can change the sentence to actually make something that is tethered across. So improper use of punctuation. All right, so too vague. Fails to include personal experience. That's why you say it was general. Grammatically unstable or has instability, meaning like the grammar was poor. Spelling error, that was the physician part that was supposed to be there. It doesn't answer any question that I'm asking. It doesn't even give me a reason why they want to be a doctor. It just kind of talks around the subject. And they don't have any examples. So let's contrast that with this one. All right, go ahead and take a read of that. All right. Cool. So I have a young lady in a white top with hair up like this and curls that come down here. Yep, just smiled. Yeah. Is your mic on? You got can you use your mic?
Yes,
Excellent. What do you like about this, or what do you think is going on with this statement?
Something I like is how they use something that's really like specific and unique, talking about being a farmer's son. And so it's an experience not everyone would have, and it kind of makes them stand out. But then they were able to like use that to speak on passion and dedication, and then loop that in with like their goal of becoming a physician.
Excellent. I agree. I do feel like they tethered some of those ideas. That is the layering and anchoring that we spoke about earlier, right? Cool. All right, I'm gonna bring in. I mentioned earlier the men with the tie on and the gingham check. What do you like about this one?
It has a lot of support. So you mentioned supporting your premise.
Yep.
Rap is, the ability to be dedicated and work hard.
That's what I'm talking about. So the idea, the premise is that this person knows a hard day's work. I mean, they know how to not only work hard in one capacity because they are the son of a farmer, but also that they worked in a lab, and those days the long days don't deter their desire to do this type of work. So that's good. If I'm reading it, I'm like, all right, so this is somebody I could put in the system, and they're going to go ahead and show me that they're willing to work. Other things that I would just note as examples. Hold on, if I can pull this next one up. Right, so that's Leroy Green. You got the glow. Personal story with context. Excellent. Forms a bridge between their life experience and their interest in medicine. The grammar was right. Spelling errors were all removed. And there's support, like you said. It gives this context of not only am I a hard worker, but I want to do medicine because of these things and these experiences. These are the parts where people make their largest mistakes, all right? Now, this is when we're going to have a real conversation in the next, I think we're going to wrap up shortly. Can someone give me a time check?
I think we're supposed to be done at 12:30.
Okay.
I don't know.
All right. I don't remember how many slides left, but I mean, I'm trying to make sure I'm staying within the time frame. So, common pitfalls. The main thing here is you can't use the same narratives that everybody else is using. Now, if it is your story, please, do your thing. I'm going to give you a couple examples of common or cliche things, right? So almost everybody has written a narrative where it's like, my aunt Sue, had breast cancer, and, seeing her go through the treatment cycles made me want to be a doctor. Now, that is a very real experience, and I trust that it is impactful to people. But unless your relationship with Aunt Sue was so great that it caused you to write an entire statement about it, then that to me is a not so great association. And it sounds like multiple other people's statements. Ways that changes is if Aunt Sue is the person who taught you the periodic table of elements, she introduced you to science, and then she passes because of a medical issue. The story arc changes, right? Other things that I would not necessarily recommend. There was a period of time where everybody was writing about House. I watched the episode of House. I watched the episode of ER. I watched the episode of Real Lives of this, and it made me want to be a doctor. Doctors hate seeing that. Surprise. We don't like that. So if it is what made you want to be a doctor, save that for casual conversation, because it's more fun to express that in that environment rather than in writing. Because all we're going to say is, what other TV shows could you have watched? Is that not going to make you want to be a lawyer because you watched, Perry Mason? Is that going to make you want to be a crime scene investigator because you watched SVU? Like, you got to be able to differentiate reasons why. And then finally, personal drama, right? So you can always, everybody got drama. Everybody has such situations in their life that, may have driven them. But if your personal drama is just like ugly, messy drama, and you're more so giving me Real Housewives / love and hip hop vibe from your story, I'm going to be like, yo, this is a lot. And I'm probably going to stop reading. Okay. So don't be cliche. Second part, man, that spell check button is there for a reason, y'all. I know you think that you probably are, a scripts champion, but in real life, we have those of you that don't know what scripts is the spelling bee competition that happens every year. So that's scripts, but except for this year, but the spelling is important. If I find a spelling error or a grammatical error or the improper use of homophones, that probably is going to bother me. It seems to be a pet peeve for a lot of people, but know the difference between like the different there, and theirs, right? You should know that and use it appropriately. Second is grammatical errors. So subject verb agreement is huge. Fragments. You can use fragments, but it's just, how are you using it? Is it an emphatic statement? Know how to do that. The use of starting sentences with and, but, you can do that too, but you have to be savvy enough of a writer to make sure that it's done well, and you don't do it often. And then finally, tone, making sure that your tone is not just like this kind of, I call it passive tone, but it almost feels like everything is a question. Like, it's like, I may do this. I may be able to, like, if I was able to do this, like, just say it. Just say the statement in a way that is affirmative, because otherwise, if you don't believe it, they're not going to believe it. Vernacular. I know that people love to say I'm a doctor, but there are lots of doctors, right? You can be a doctor of philosophy. You can be a doctor of sociology. And if you tell me I want to be a doctor, I'm gonna be like, okay. But you say physician, I know exactly what type you're speaking about. So I would change my language to say physician whenever speaking about medical doctors. And then finally, your vocabulary is something that I notice off the bat. When I talk to people, I understand their vocabulary. And here's the secret. You grow your vocabulary by reading more. Right? When you read the way that the words are used. Like, there's a word, zeitgeist. Has anybody ever heard of it? Used it? When I hear someone use zeitgeist appropriately, I'm like, oh my God. It is a hard word to weave in. Or aegis. Under the aegis of doing something. Like there are words that we have that are used to literally make the statement that you're trying to make perfectly. You just have to do the digging. So think about increasing your vocabulary by reading and seeing how other authors are using some of those words. Lying, please don't lie. This is what we call capping. Don't be capping in your statement. I promise you, we will find out, and I'm gonna ask in real time. I'm gonna say, oh, so so you led a troop of people into Ecuador, and that's where you had to win. And so you speak Spanish. Okay, and then I started doing the interview in Spanish, and there's a problem. So don't lie. All right. And then I would say, just be timely with your submissions, yo. Don't waste time. So this is Misty Copeland on the side over here. If you ever get a chance, ever in the future, maybe when they open outside again, to see her, you should. So here's like an exercise that I would do at home when you're starting to do it. This is how you can start to build the anatomy of your statement. You write down a premise. Make the premise strong. Try to be concise. You write down an anchor. So that is one thing, one trait, one quality that you are going to try to connect the premise to. Then you give me 3 pivot points. Those are the things that you're going to see in your story, in your narrative that shift and change the position. And then you write 1 boomerang sentence, something that arcs back to what you're doing. So I'm going to give you guys some of my statement. How much time do we have, y'all? Stefan? Well,
You have 15
10 minutes. 10 minutes.
10 minutes. Great.
Yeah.
So I'll whittle this down, right? So usually between the 2 talks, I give a little bit of perspective about why I'm qualified to talk about this stuff, right? Now, it's hard to talk about sometimes because, again, as I said, it might be triggering for some. Every time I give this conversation, I feel a little bit of transference or rather counter-transference. So I'm one of those guys that spend a lot of time working on personal statements because I applied to medical school a lot of times, and I've received a lot of rejections. So, I'm the type of student that in high school, everything was pretty natural to me. Like I could go to sleep the night before a test, the morning of the test, read the material, go into the test and kill the test. I was that type of student, and it was an ability, and I leaned on that ability all the way into college. And I got to college, and I just remember saying to myself, like, I'm at Morehouse, man. These are intelligent people, but I belong here, and so we're going to use those same tactics. I walked into the test. I remember taking this biology exam, and everybody had been studying their tails off. Of course, me thinking I could just use like a couple of days, get the material, go in and kill the test. That's not what happened. We all went in there, took this test, and everybody's head was hung low when we exited the test. And I remember looking at the first question and feeling essentially like I felt like I was in a title fight. And if you've seen old Mike Tyson and new Mike Tyson and how hard he hits, that's how these questions were hitting me. So I just remember going one after another, catching Mike Tyson jabs, and literally feeling like if I just make it to the end of this, the first thing I'm going to do is cry. The second thing I'm going to do is sleep. And I remember getting the score results, and everybody was like, man, that test was hard, but I barely passed and that stuff. I looked at my score results, and I was like, I got like a 36 or something. Right. And so I said, dude, this ain't me. So, you go to look at yourself in the mirror. You're like, come on, Italo. You start talking to yourself and hyping yourself back up. And I took the test, the next test, that midterm. I failed the midterm, got like 3 points higher. It was like 39. And it set in very quickly to me that I was definitely not, the tactics that I had been using were not going to be the same, or were not going to be effective. And I really just hit one hurdle after another through my entire college career at Morehouse. I ended up failing a 1-credit lab and was notified about it days before my graduation. So my whole family is down in Atlanta, Georgia, expecting me to graduate with my 2.7 GPA. And I failed this one credit lab. And they tell me, I'm sorry, you're not going to be able to walk with your class. This is already after losing an academic scholarship. This is already after having to repeat 3 different classes, physiology, biochem, physiology lab. And I finished feeling low. Somehow I got into School of Public Health, and I thought I was going to continue doing those same things, same tactics. And in that first year, I think I spent more time at my friends' houses than I spent actually studying and writing. The only saving grace for me in grad school was the fact that most of our classes were lecture-based, and my ideas would come across well in lecture. And so I could defend what I said well, but the evidence on exams, on those biostats tests was not coming through. Then one day I got snatched out of class. Now, in grad school, I am a grown man at this point. I am of voting age, smoking age, drinking age, any age that allows you to say that you are grown. I paid taxes, and somebody came and asked me to step out of class, and it was a lady by the name of Nagina Lithcott. So Dr. Lithcott was the assistant dean at Boston University School of Public Health. And she sat me down in a room, had me close the door. Her room was massive, looked like an Ivy League personal office, and leather-bound chairs with books that cascaded from the ceilings. And she looked me in the eyes and said, "What the F are you doing?" And I said, "Well, hold on now. You can't talk to me like that. Like, we're adults. You're not gonna cuss at me." But, you know, in saying that, it was like that rude awakening. It was the blanching of my soul. It was the shock factor that let me know that this was not a game. And she said, "You have so much talent and ability, and you're wasting it. You're squandering it all." So she said, "I'm gonna do you a favor. I'm going to help you. I'm gonna help you in a way that no one has helped other people at this school before, and in a way that when I was your age, I wish somebody would have helped me." She sat me down. She said, "I'm going to give you a scholarship. I'm going to give you a retroactive and a proactive scholarship." And she said, "I'm going to give you study guides, study aids. I'm going to give you a teaching aid assistant or whatever to help you. We're going to figure out how you learn and deconstruct that. I'm going to build you a sleep schedule. I'm going to build you a work schedule." Like, she did all those things with me. And out of that relationship, I felt like somebody cared and somebody actually believed what I had been believing about myself for the longest. I was able to correct my grade point average. I eventually took the MCAT multiple times. I took it 3 times. And the first 2 times I took it in college in the first year. Then she had this, come to Jesus moment with me. And then my scores jumped by 10 points. So I know the scores have shifted now to a 3-digit number. But imagine going for something that was sub 500 to something that was over 500, right? And then I re-enrolled at Harvard to pick up those classes that I did poorly on, did well in those classes. And despite all of those things, I was feeling good about myself. I understood how I learned now. I applied 60 different schools and got 60 different rejection letters. Cycle 1. I reapplied the next year, 66 schools, 66 rejection letters. And the final time I applied to 13 programs, a mixture of regular programs and post-bac programs. One school, a post-bac program, asked me to come down for an interview. I went in there looking sharp, thought I killed the interview. They told me I didn't, and I was rejected from all 13 different programs. And then at this point, I was like, it's not going to work out. I don't know what I'm going to do, but I really wanted to be a physician. I got on a plane to go to a wedding, and the plane would not take off. And I was like wondering, why is this plane not taking off? Because I'm crying. And you know, when you sit on a plane and people sit next to you and you in your feelings, you have those Drake moments where it's like you're looking out the window and like life is trying to make sense and stuff. And like one solitary tear, that was exactly how I was in that seat. And I was just like, plane, please take off so everyone can go to sleep and I could cry in the corner. Plane wouldn't take off. They asked us, it was a mechanical issue. We all had to get off the plane. When I got off the plane, my phone rings. I answered the phone. And it was, she said, hello, can I speak to Italo? I was like, this is Italo. It's like, this is Dean Pamela Williams at Meharry Medical College. How are you? I'm all right. You know, slightly, you know, trying to suck up the tears now. And she's like, we have a post-bac program. We have a slot open. I'd love to know if you'd like to come down and be a part of it. And so before she finished saying a part of it, I was like, yes. It was a Thursday when this happened. The class started on Monday. So I went to the wedding. I quit my job while at a wedding. I got permission from the program to give me 1 week. I flew back to Boston. I packed my bags up into 2 suitcases. I got back on another plane. I flew down to Nashville. I lived in a hotel for 2.5 weeks. I lived at the dorms on the campus of Fisk for 2 months. And I went to class every day and eventually worked so hard that they gave me a scholarship for the whole post-bac program. And then I matriculated, never having to take the MCAT again, directly into Meharry Medical College. So I stand before you or sit before you today as a guy who has had well over 128 rejections for medical school, failed the MCAT twice, never received a medical school interview, and I'm an assistant professor at Stanford. So I'm telling you that if you all can write your narrative and own your narratives and own your failures, you have the ability to do exactly the same, if not way better. All right. So that is how I bring it to a resounding close. Tell your narrative as it relates to your interest in medicine. I gave you a story about failures. I gave you a story about false starts. This is exactly what I see in the emergency department all the time. I deal with people who are struggling. Why else would I not? Why would I be there? I would be there because I know they need somebody who understands that, and I do. And then you use the revision process to scope your statement. How many times do you think I've told this story? There are at least 3 podcasts in the interview that are floating around right now with almost every single element of what I said. And I've given this same lecture 3 other times. Craft the story, planning, then time it appropriately, manage it appropriately. It took time to come up with these narratives. I had to go through every single emotion and be very targeted how I tell it. And then you submit and prepare for the interview. You guys got any questions?
Dr. Brown?
Yep.
Thank you. That is exactly why PMF wanted to do this workshop. And you have been amazing, not only with this one, but on the previous ones. I would like to add a couple of other things to your statements. Not only is your personal statements for medical school, but also for scholarships, as you so well mentioned. I sit on the committee of awards for a major national scholarship organization. And I read a lot of the personal statements that they submit, and you can just know who's going to get the scholarship.
That's right.
Who's not going to get the scholarship. The other thing that happens is when people send their attachments, and then in the email, many of them forget the name. The subject lines are not good. So when you are a doctor or an administrator and you don't put and you got a lot of emails and stuff coming at you, the email that has all of that good information, your name, your contact, a good subject line, please know that it is important. On this particular program alone, I've got many questions where somebody just sends me one statement. So when is it going to start? No name, no nothing. So you guys, please pay attention. You are always on Showtime, as he said. It is important not only for applying for medical school, but also for those scholarships. That is really, really, really key. And with that, I want to thank you. And now we can go into questions, okay? So we have a question from Jonah. For personal goals, In the personal statements, should you be specific in your occupation pursuit or be more broad?
I'm going to answer that by saying that it's really up to you. I will say that people like specifics in medicine. Like we are an empirical group of people. Like we love to have evidence and direction and give me the answer. So if you are specific, that is also good. But in terms of being broad, I will say that you basically need to know that if you're broad, qualify why you're broad. You know, like qualify. I'll give you an example. If you're saying that I feel like if your whole premise is around blending healthcare and technology to improve health outcomes, and you can't tell me the app that you're trying to build because you haven't thought of it yet, that's okay. I don't want you to be like, yeah, I plan on building a specific app. Like if you don't have it all thought out and you don't want to give up the idea, you don't have to be specific there, but you can absolutely talk about the impact that technology has on health and the fact that you see it and how your knowledge and ability to navigate that makes you better at doing both. So you can be very general. The specific part I would say that helps is when you're saying things like, if you are passionate about one particular facet or subset of medicine, like some people love research. That is a good time to be specific. If you're someone who's been doing some type of research or you have a research mentor, be specific. They want to see that. If you're somebody who is like, I met someone who was this type of physician and they let me do certain things in shadowing them, great time to be specific about an aim. It's like, I want to be an orthopedist because when I was a young person, I had this injury. I developed a relationship with my orthopedist. And then when I got older, I shadowed that orthopedist and I learned about how to do this and that and the other. Great time to be specific. So I would say you could play either way. You just have to kind of think about it from the context of what you're trying to convey ultimately.
Okay, another question. When it comes to reading, is nonfiction or fiction better? And this is, and I'm sorry if I'm mispronouncing your name, from Sabira.
Sorry, it's Sabira.
Sabira. Okay, thank you.
All right, Sabira. So, all right, this is where I got to be transparent. I don't read a lot of fiction, but that doesn't mean that reading fiction is bad. In fact, I think that now more than ever, fiction reading is not only super popular, but it gives you so many different collaterals in terms of like things you can talk about. I feel like fiction is better at telling stories than nonfiction, obviously. So you can learn about how to craft and create and take a reader through something. The other thing about nonfiction is there is a huge subculture of people who read there's a culture around fiction readers. So fantasy, whatever, there's a huge culture around it. And the chances that you're going to cross paths with somebody who is a fiction reader is high. So I almost say from two senses, it makes sense to read fiction. One, because you learn how to write stories better from fiction writers. Two, because you're going to remember what you read and what you wrote, and you might be able to reference it later in an interview or in a conversation with somebody, and it gives you another overlapping point. So I do think that fiction reading is good. Now, why I say nonfiction is like the golden standard for this, it's because you need to read about other people's life stories. You need to read about like very hard hitting editorial and op-eds. The way people structure things is different than in a fantasy book. A fantasy book, most of the time you can get away with just telling the story. You don't have to follow all the grammatical rules. When you read an op-ed, to get published in the New York Times, it has to follow a certain structure. To get published in the Atlantic, it has to follow a certain structure. Washington Post, LA Times, San Francisco Chronicle, all of these have requirements, and the editors are a lot more rigorous than in a fantasy setting. I can write a fantasy. This is not to be like, I have one of my best friends. His name is Alaron Kong. You can look him up. He was an internal medicine physician, trained at Morehouse and trained at Grady, and quit his job as a physician to be a fantasy writer. He writes fantasy novels and is the only Black dude in his specific field of fantasy. Only Black dude doing this particular type of fantasy writing. I watched him write his books while he was on call. I say that to say his ability to craft a story is great, but I'm not going to see his stuff published in the New York Times. And when he wrote that personal statement, he wasn't writing fantasy. I will tell you that there is an ability to do both. His creative mind is always going to be great, but he will also champion, and this is because this is a guy that I know very well, he would champion the fact that he reads way more nonfiction than he reads fiction. So I think that there's a value in doing both.
By the way, the comments are wonderful, you guys. Thank you for them. I have another question from Valerie. It says, I have a pre-med friend who found out she has epilepsy while applying to medical school. Should she mention this in her personal statement? Would it hurt her?
Oh, this is a tough question.
And let me add to that so you can do them both together. There's another one from Nyla, I think it is. If a person with mental health issues wanted to become a therapist, would it be cliche for them to talk about their struggles in a personal essay? So these are both related to the person having some kind of health issue.
Got it.
In terms of how far do you go? Where do you go? Where is the boundary lines for that?
All right. So the reason why these are sensitive issues is because both of those particular spheres of illness or of condition, I would say that, not necessarily illness, those spheres of conditions have stigma, right? Mm-hmm. So mental health stigma still is pretty strong. And I think that it's hard for people to understand the full scope of certain mental illnesses or mental health issue or wellness as it relates to a candidate. I'm not saying, I am going to outright say, if you write about a mental health issue, please give it context, make it contextual, make sure that you are talking about how it does not hinder you. Like, you can share that information, but know that once it's on page, once it is in somebody's hands, they can potentially discriminate against you or subconsciously have a bias against candidates who convey this information. So I'd be very careful about sharing information about mental health issues only because it is stigmatized heavily in our field. With the second part, seizure or epilepsy is, oh man. So the reason why I would say, like, so I've had colleagues, when I was in residency, one of the sharpest physicians that I knew, she had epilepsy. She had a seizure while we was on shift one time. But the point is, she was a physician. So if that tells you anything, it's not something that should stop someone from selecting you as a physician. So epilepsy to me is not as stigmatized. What I will say is you gotta give context for that too, because what you don't want it to come across as is, I have seizure disorder, and as a student or as a doctor, I might have a seizure at any moment. Like, you have to use words like, I had seizures when I was a child, and ever since then they've become well controlled, but understanding this has made me want to become a neurologist, and right? You give context to it. And with the mental health stuff, I would say, if you are talking about overcoming something like grief, something like trauma, violence, like exposure to violence, these mental health areas are actually looked upon favorably in statements, as opposed to saying like, hey, I have, schizophrenia. Like, that is something that most people reading it will be like, red flag. So be aware that although your desire to share it and share that part of your narrative may be earnest, may be really sincere, it may not be the best thing to share or anchor your story around. You got to sometimes think a little bit more so in a political way, or in a way that gives you your best fighting chance to get selected.
So well put. There is, in addition to supporting what Dr. Brown has said, you guys may see the message from Dr. Cara Miller regarding some compelling things about personal statements and others, so be sure to read that. The other thing is, let's see, another question had to do with mentorship. And I think this was from Aaliyah. Where should I start looking for a mentor? And after your response, Dr. Brown, I have a couple of things I'd add to that too, regarding mentorships.
Okay, so mentors are, in my opinion, right now at the access to mentors, the threshold to find one is an all-time low, meaning people are available more so than they've ever been before because of COVID-19, right? So a lot of people have more time and are being brought closer to the need for mentorship. Because that has been the largest thing for a long time, is getting our mentors to understand that, like, we're having a growing population of people who want to do this stuff, and that there is not enough available people around to give insight. So take advantage of that. Now you're saying, where do you find them from? Well, there's a couple traditional routes. The first way I would say, obviously, is to think about the different touch points you've had with healthcare. So your personal physician, family members who know physicians personally, people who have, like, family friends that are physicians. If you have no one in your family that is a physician, you can always go to the next rung and look at a family friend. The second way is, if you know an existing medical student, and say, who is your mentor? Would they be interested in mentoring me? Would they be interested in talking to me? Shoot them an email, right? The third way that I'd say is, there are organizations that right now are basically, you know, when you see like a semi-annual sale at a store, it's like everything must go. Right now, there are organizations that are treating mentorship like a semi-annual sale. They are finding and connecting people like nobody's business with mentors, because they understand how this disproportionately puts candidates who come from underrepresented backgrounds in medicine at a disadvantage, because our traditional ways of getting mentors are all kind of blocked up. You can't see them anymore. So now you have to work overtime to connect people with folks who are willing to give that type of guided advice, guidance and advisement. With that said, the SNMA has a junior version, like a pre-medical version, that I think would be beneficial for you all to look into if you are college students, or if you're like any pre-medical, you can look into that section and then ask for mentorship. Then if you have a specialty that you're specifically interested in, usually they have mentorship organizations already established around that. Like, I know I'm in emergency medicine. We have AAEM, SAEM. We have all these different groups that have pre-medical ties, and they build vertical mentorship streams. So I think that those are the ways that I would approach it. And then the last way is cold call, cold email. You can Google somebody and be like, hey, I saw you, you were on this article. I was wondering if you were able to have a conversation for 5 minutes via Zoom, or listen to me talk about questions that I have around your field. I'd love to find out more about what you do. Send it off, shoot your shot. At this point, you have nothing to lose, literally. So I would recommend doing that.
That is great. And might I add that it is also in your search to find a good mentor. Physicians Medical Forum is really a good place to start, but also it is very important, and we go through this in our program, about being a good mentee, because sometimes you find a good mentor and then you don't follow up with that mentor, or you don't do your part to make sure that their time, their valuable time to support you is appreciated. And I want to be really clear about that, because that is so important. I hear it often from physicians, from educators, that it is so important. Please, please echo that out to students to take care and do due diligence when they ask for us.
I'm just sipping my tea, because what you are saying, this is the red letter text in the Bible. Right. You are speaking the gospel.
Yes. Okay, and then we have a question from Holden. And Holden's question is, as an older aspirant, I find it slightly difficult to hone in on the best topics to include in my personal statements, drafts, okay? Are there any suggestions on what to include or not include, and how to decide what experiences would be suitable for an older medical aspirant?
Holden,
yeah.
This is a fantastic question, and I first and foremost commend you for bringing that to the forefront. We have a lot of non-traditional students probably on this thread, and they are seeking some of the same questions that you have. And it's easy to get lost in the shuffle because one, you know, having the desire to do something in mid-career or later in your young career is hard to navigate. Like, it's not a whole lot of people doing this stuff. I want to share with you one quick story. My buddy from college, this is just like, I'm looking at you when I'm talking to you about this, even though I know there's other people on here. Buddy from college, we both went to Morehouse College 2002. His name is Jamil Lacey. Jamil Lacey and I are good friends. He's from Oakland, born and raised, looked like Slim from 112. And, you know, he initially started out as a biology major and then switched his major and then ended up leaving Morehouse. He went to school in London for a little bit, did some urban planning. He ended up graduating from like NYU at some point, or went to NYU for a point of his career, and then came back to Morehouse probably 2 years after I graduated and just finished his degree. And then while he started going to urban planning, he realized, he was like, man, I keep finding out these problems, and these problems are all boiling down to health issues. And he was like, what is going on? So he started working as a teacher, just standard teacher in schools, and started seeing that his kids didn't have safe places to go home to, and it affected their learning. He started seeing that these kids' health were impacted because they had parents that didn't have like the full understanding of their health issues. And he started just taking these things on. He began a group called Trap Medicine, where he started having barbershop-based health interventions, where he talked to Black men and boys about health issues and topics. And then it turned into grant funding, and then it turned into partnerships. And then next thing you knew, he grew this entire engine around trying to support the lives of Black men and boys. And then he said, I think I want to be a doctor. So at the age of 36, he applied to medical school, or 35, he applied to medical school. Let me rephrase. At the age of 35, he took the MCAT. He didn't do as well as he wanted to. He did it again. 36, he applied to medical school. He got accepted to probably like 4 or 5 medical schools. When I tell you that 3 medical schools offered him full tuition scholarships. He's at UCLA Drew on a full scholarship as a 36-year-old candidate. He gave the white coat speech a month ago. So I hear what you're saying about coming at this as an older adult, but these are the things that being an older adult in this game affords you: perspective. If Jamil hadn't lived all them different lives, he wouldn't know the full spectrum and scope of what he was trying to accomplish. It gives you experience. He had several jobs by that time, enough jobs to find out certain things that he can extract and say, I want to use this to build in my statement. It also gives you friends. He just called me. I'll tell you what you should write. He had so many friends that were built-in, baked-in mentors, and people who had done it, who said, hey man, I remember when I did this, don't do that. So you've lived long enough for the people to go through the first pass of the gauntlet and tell you, duck now, jump over this, here comes the spike, watch out for this swinging thing. You have enough people in your circle who've done this to give you expert advice so you can come through that thing and just do the Watusi all the way down the gauntlet. And at the end of it, you are more, I would say, you're more apt to be a adult learner, because that's the biggest hurdle for most people going into medical school, is making the transition from being just, a college learner and kind of do my thing to being an adult learner, where you have to build your own schedule and study and hold yourself responsible for things. You know what that's like already. All right. And that's what they want to see and hear about. So I hear you when you say it's hard to come up with those narratives and those things, but I'm telling you, you have so much material. All you have to do is sit down and look at your life and say, what is the point that I'm trying to make on the back end, and go back and start extracting little things and nuggets and just align them. And then when you get to them in front of them to tell them these things, then you use all the full picture to kind of paint it for them. Okay. Hopefully that gives you some information.
Thank you. thank you again, Dr. Brown. And I just want to also thank Dr. Miller for her continuous response, so you can take a break because she's helped answering some of the questions in the more extensive way.
I appreciate that so much.
Yes, yes, it's very helpful, especially the question from Dorian regarding admissions panels and so forth, because he can't answer all the questions, but we're trying our best. Okay, so I think that this wraps up this particular part of the personal statement. Again, thank you for all of your wonderful comments, your questions, and your responses. Italo, they love you. It's really, really good.
I love them too.
Yes, yes. So let's take a break till what, 1 o'clock, give you a chance to you know, kind of grab some eats and refresh yourself, a little bit of water or whatever you need, and we'll come back exactly at 1 o'clock. Is that okay? All right. Thank you.
All right.
All right. Hi, everybody. Everybody's back. Had a little refresh. We're ready to start with our third workshop, Dr. Brown. Are you there?
I'm here.
You're here.
Okay. All right. Everybody is back. So now we should proceed, and let's go for the third workshop. Just to clarify, we will probably stop the delivery or the presentation about 1:45. And then we'll take 15 minutes worth of questions to 2 o'clock. So we may end a little bit early. The other thing is Dr. Miller will be answering some of your questions that you have in case Dr. Brown could not answer all of them, okay? All right.
Cool. All right, so we are down to the last conversation of the day. And I just appreciate those of you who are still with us today. I know it's a lot of material, it's a long day, but I guarantee that this stuff is valuable and it'll help you kind of to be as successful as you can be, and more importantly, to chart a course towards your dreams. So this presentation is called Conquering the Interview. And what I'd like to kind of like give as context here is everybody needs to know interview skills, right? Like you have to know this. It's the way we get jobs. There is not a single profession that I know of that you can just like, unless you started your own self, that you don't need to know how to have or how to interview or have good interview skills. The hard part about interviewing is usually because we have anxiety around it, and we don't see it as what it truly is, which is a conversation. Like you're having an open conversation between you and somebody who's trying to learn more about you to make a decision, right? So we're going to talk about some of the strategies and tactics that you can employ to interview well, but more importantly, to leave a lasting impression. All right. So I mentioned earlier that, you know, interviews serve a bunch of purposes, right? But you need to think of this as a bimodal thing, like goes in two directions. Or a dichotomy. That's probably a better word. So it serves the purpose for the school, the institution that you're trying to apply to, because what they're doing is using this interview to figure out who you are. They want to assess what your skills are and your characteristics and see if they're in alignment with the values of the institution. The second thing is they're trying to figure out if what you presented on paper is the same thing that you are in the real form, right? So they want to know, is there consistency between who you project and who you actually manifest as, right? And then finally, it's their way of creating a brand for the school. They're trying to make sure that people are interested. It gives them numbers. It drives the level of competition or the competitiveness of the school. When they say, oh, we had this many people who applied, we interviewed this many number of people, that makes the school seem more elite. So understand that it is one way to kind of contextualize it is that it is a benefit to the school. Now, what it serves for you, the purpose it serves for you is you get the opportunity to brand as well. You get to figure out, this is who I am and who you're going to meet today. And I'm bringing all of these faculties with me. So now your brand is who they encounter. Second thing is, it's your opportunity to really do some interrogation. You can ask them questions. You can learn about these schools and these programs in an interview, and you can feel out whether or not the school is a good fit for you because you're interacting with people. So this is a two-way street. Never feel like an interview is one-sided. Know yourself, know your worth. This is a quote from, well, obviously people have said it before, but I think I got this from a Drake line. At the end of the day, you have to be an advocate for yourself and champion yourself, which is why I always say, like, in terms of writing your narrative and figuring out who you are, you will intrinsically be reminded of the things that you bring to the table. And in some cases, you're going to remind yourself that I bring the table. So always go back and reflect on those strengths, those weaknesses, those opportunities for growth, the ways you have grown, what you expect to do in your career, like the entire career arc, things that you value, things that you do well, how you deal with disappointment. Like, all of these things help people to gain a critical understanding of you. And if you know it off the top, then you understand the value, and you can make them understand the value. You need to know your application like the back of your hand. Anything that's in the application is fair game. I will say that again. Anything that you put in an application is fair game. So that means if you write a personal statement and it has a certain part of the statement that says you speak another language, understand that I've seen situations where people have gone into the other language in the interview and been exposed. So be careful about languages. If you do not speak fluently in that language, don't say that you do. But also things like, I've had people look at my parts of my statements and be like, oh, you went to and traveled to this region, and then want to talk about that or talk about experiences that I've had, and it makes the conversation more valuable and more robust. So also, don't run from the negative points. So things that that are like pain points, be prepared to discuss them in a way that gives you leverage. So I always, I think that knowing your worth, knowing yourself also goes hand in hand with knowing the entire body of work. So how many of you all right now say that you have a CV or a resume? All right. I see my man that used to work up at Stanford. What's going on, dude? He knows who he is. What's up, man? All right. So at any rate, you need to know your CV, your resume, and that stuff is not made overnight, right? I don't know how many of you guys have taken the time to update them, but it is a painstaking process. It is literally my top 5 least favorite things to do in the world is to update a resume. It's right there next to going through emails. So you need to figure out how you can do it in a way that makes sense. So some people say do it twice a year. When you get a little bit more advanced, some people, like, for example, in professional spheres, a lot of my mentors, they update their resume once a month or their CVs once a month with, because things like this would count, like talks. Anytime you go to a workshop or attend a seminar, those are things you can put on it. And so you have to keep it kind of like, it's called CV or resume hygiene. You want to keep it up. Send it around, get feedback. People say, hey, this font's too small. Hey, I don't like the alignment here. You have a typo here. Send it around so you can figure out how to make it better. And also, there are examples of ways that you can do it creatively now. There's a website called Canva. I know this is kind of a stretch, but I will say that people are now a little bit more open to CVs that don't look like traditional resumes or CVs. Before, it had to all be white, very clean, cut, and prim. Now you can do some with a little bit of color, some like different font types, weights of the font. So you can use things like Canva to help get ideas on how to make a resume pop or make a resume look like it's different from the others and still have the same information. proofread it, and then know the difference between the two. So I've mentioned CV and resume kind of casually. The difference between the two is that a resume is usually 1 page, 2 pages max. A CV can be as many pages as possible. Some people have CVs up to like 40 pages of just events, I mean, not events, but things that they've contributed to create a robust body of work. The resume is most recent things, most impactful things, concise, and showcases your abilities and strengths. You want to evaluate your prospects kind of like aggressively. So this means the folks who you're applying to, put them through a rigorous evaluation process as well, because they're doing the same thing to you. You need to be about finding an alignment. So that means knowing the school, understanding what its mission statement is, understanding what they tout as their principles. How do they grade you? Are they pass fail? Are they letter grade? What's their style? What's the curriculum style? Are they doing organ systems? Are they teaching you in blocks? Do they provide set aside time for step 1 prep? Is it woven into the curriculum? You should know these things before you apply. Use available resources. So I think that the number one resource most of the time is someone who's attending that institution. A firsthand experience speaks volumes. You talk to somebody and they're like, man, I love it. Every time I have a question, I walk right in the office, they're there. They give us study materials. They pay for our practice exams. We get to take our exams in a nice, cool study facility. Like that helps. And you be like, oh, I kind of like that. As opposed to somebody who's like, it's cool. I spend a lot of time studying at home. I just go through modules from other programs of learning that I pay for. Like that'll tell you something about the school, right? And then so there's other resources, right? I think the one that I would say, there used to be this thing called I forgot what it was, but it's like a booklet where it talks about all the different medical schools and it lists a bunch of different facts for each one of these medical schools. You can get it through AAMC, but it is like an almanac of all the medical schools, and it talks about what their like average GPA of accepted people are, number of applicants every year, what the principals are, where they stand on certain issues. Those are going to be a good resource for you. And then finally, websites. So, I'm a website stalker. I'm not even going to play with you guys. I'm telling you the truth. When I decided to come out here to Stanford, I went all up and through the department to figure out, I was like, all right, so how many people of color do you have? What is your statement on diversity? What is this, that, and the other? Like I went through it and I was like, let me figure out where I'm actually going so that I have more insight. And I think that that's a vested way of trying to approach your education, your future. And as we already talked about the difference between allopathic and osteopathic medicine, they may have schools of dentistry and pharmacy that may change. That may change the way that you view the school if it's only like unidimensional. And then I said these are not plan B, meaning like each one you have to treat like it's a plan A. You may have in your mind that there's like plan A, B, C, D, E, F, G, whatever, but when they hear about it, they want to be the option number 1. So go in and look at each school as though it is what place you're going to land. Because if you're saying, it was my fallback plan to end up at, the Institute of Random Saskatchewan University, and you're not happy there, that ain't going to work, because you have to know what is going to be a plan A, and that getting into medical school is what trumps the most, what is the most important to you. All right. Preparing. So, all right. This is where I kind of get a little bit more casual with the conversation, because I know that interview days are stressful. The last thing I want is my talk on interviewing to be stressful. So we'll get a little bit more comfortable. Know that your attire matters, right? I think that one of the hardest things to do, let's step outside the framework for a second and say, a lot of what I'm going to share has changed, because this is a talk that's built for in-person interviews. Most interviews this year are going to be virtual. So with that, there's going to be an entire amount of things to take into account. So I'm going to go off script on some of these slides to give you this information. And when I do it, write it down, or we'll have, I think this is going to be recorded so you can go back and reference it. With that said, attire still matters. If you are going for a formal interview, even if you are at your house right next, about to play Call of Duty, you need to be able to still come to the table looking like you're trying to be successful at it. So know that you need a suit, know that you need to have business attire, a business suit, or a very nice dress, not too flashy stuff going on for an interview. Be aware of your habits. So this is a huge thing for me. Like, I've been doing it, unfortunately, all throughout this conversation, playing with my hair, moving my hair. But when you are interviewing, you want your hair, I'll talk about it later, but you want to make sure that you are minimizing those habits. Other habits, uhs, likes, throwing out these fillers that end up making you sound a little bit more, as I did just now, but throwing out those fillers that you use to gather your thoughts, but they can be very distracting to an interviewer, right? So think about those things. And eat well on the day before. No one wants to have you sitting across from them and hearing the rumble of your stomach. During one of my talks today, I realized that I needed to take a snack. So on the break, I went ahead and had some trail mix, but I could feel it. No one wants the bubble guts during an interview. It makes you not focus on the questions. It makes the person who's across from you uncomfortable. Like, dude, do you need a Snickers? So do that. Then finally, I would say always be prepared in terms of your sleep hygiene, rest. Make sure you give yourself adequate preparation time. All right. So I'm gonna go men then women. And the reason is because I feel like the conversation for men is a lot more streamlined because the way that the rules of business and stuff like that is extremely misogynistic, and it is kind of streamlined some of these things so that men have fewer things to worry about, and women have been nitpicked for years about their business attire. So we're going to talk about the entire spectrum of those things. For my men that are on here, or people who identify as men, the main thing is color of the suit, having a suit, having things that seem to match. Now, half of this is going to be taken out because you are only going to be seen from about the mid-chest up. So, surprise, you kind of win on that. But let's imagine that you weren't sitting down in front of a camera and you were in front of a person. So the suit matters. You want a suit that fits you like a second skin, all right? The suit color should be blue, charcoal, or black. So dark colors are more suitable for business. If it has stripes or a pattern, it has to be very fine. Please don't pull up in a Steve Harvey suit. Unless I'm like old Steve Harvey, not new Steve Harvey. New Steve Harvey got checked so many times that now all his suits look amazing. But with that said, don't have the Easter suit, 8 buttons, 4 buttons. You should have your number of buttons on a suit jacket should be the number of times it takes you to get something correct, plus 1. All right. It should only take you 1 time to get something correct. Add 1. 2 buttons max for your jackets. All right. The shoes. The shoes are important because if you are wearing something that is distracting, like you got on a pair of gaiters, a pair of Air Forces, all of these things do not appear as professional. Mahershala Ali right here. He has almost the exact same kind of setup with the exception of the tie. Darker tie, blue suit, pocket square that's folded, executed well. You did the same thing. Yeah. So what I'm saying is, in general, you want them to pay attention to you, not to your suit, not to your tie, not to the things you got on. Then I would say more importantly, like the shirt color, I used to love like super bright neon green shirts with like a pistachio. All that stuff was cool to me at first. And then I realized, like, if I'm going on an interview, they're going to be saying like, damn, this shirt is bright. So you have to really think about toning it down. Whites are good. I do think my favorite color in a suit is like a very light blue. Of a shirt, like a very light blue or very pale pink. Like almost a pale pink gives you a little bit of color and allows you to stand out a little bit, but nothing distracting. Don't come through in a black on black, murdered out suit That's not what we want. Or this is, unfortunately, brothers love the color like this Merlot, burgundy. Stop. No. Don't do that. The other thing, and I'm going to say this very, to be politically correct here, right? We have a lot of folks who have roots, like African roots, Nigerian, Ghanaian roots. We know that you have very robust wares. In an interview, we're not ready for that yet. We're not there yet. We are not there where we see that as a extremely US-centric professional attire. I don't know if I would wear that to an interview. I would definitely wear that on days that are celebratory. I would wear that to class on any day, but I don't think we're ready to wear that in an interview. And it's just me being transparent about it, because not everybody's going to be able to understand the history behind why you have on what you have on. All right. I talked about ties. So I get the question about bow ties a lot because people love the way that they look. It makes you appear extremely intelligent. If you have like a sartorial flair, bow ties is like another thing that people throw on there. I personally do not think that bow ties are great for interviews. I think bow ties are excellent for formal events. I think they're excellent for any type of, like, if you want to go to church with your bow tie on, that's great. If you have an interview on TV and you want to stand out a little bit more, fine. But if you're talking about interviewing for a medical school position, a bow tie can be distracting and make you appear a little bit more, what's the word I want to say, like pompous. So be careful with that. And then finally, accessories for men that are acceptable. Wedding rings are great. Watches are great. There's even a study, and this is kind of crazy, but there is a study that shows, I know that everybody at this age range may not be married, but that there is a preference for people who wear glasses and have wedding rings in interviews. A standard watch that is very sleek. And the Apple watches, those work too. People are okay with that too. But just make sure that the band does not distract from the watch itself. And a tie bar. So the tie bar is just something that keeps your tie from flipping out. It compresses it to the chest. It can be very simple. You can get one that's like an inch, half inch. All right, let's keep it rolling. So now I'm on to the ladies. All right, women, people who identify as female, I want you to pay attention to this because I'm going to have this conversation in a way that, now trust me, I don't know everything about what you got to go through to dress, but I have vetted this information through multiple different sources. And so I'm sharing those lessons that I've learned. All right. One, you have a spectrum of things that you can wear to an interview. The goal is, most of the time women are saying, I want you to focus on me as the candidate. I'm trying to make sure that you understand that I'm here seriously and to take me seriously, and that I'm intelligent and that I'm fully capable. So you can do things in your outfit that are smart, that help to build and amplify that. Part of that is having a bad business suit. So every single person needs a business suit. But for women, the difference is sometimes you can't just pull your business suit off the rack. Sometimes you need to take one that fits and go get it tailored, get it to look exactly how you want it to look, because there's nothing worse than seeing somebody who is uncomfortable in the suit that they had because it's too tight here or it rides up. So spend the extra money and the time to get the piece made the way that you need it to make so that you feel comfortable and you're sitting there talking, right? So that's gonna be a suit, a blazer. You can wear the blazer plus the pants part of the suit. You can do a blazer plus like kind of a skirt that's below the knees. Those things are all kind of fair game now. And in medicine, it's like we are feeling that whole trim / tailored look stuff. So you can definitely play around there. Color wise, you have a little bit more wiggle room than most guys do because we only have about 3 colors of suits that we can wear for this. I think that I've seen successfully executed different shades of gray. So lighter gray, dark gray, charcoal gray. I've seen black executed well. I've seen blues executed well, whether it is a more, I would say, resilient type of a blue or a navy, or even if it's a blue that looks so dark that it's black. And then I've seen browns done well. Browns with a little texture, dark colored browns. I've seen that work too. And unfortunately, you know, there is not a classic rule book for this. I do think you have to learn from pictures and examples. So I would spend some time looking at some of your favorite people and seeing what they were wearing in their interviews on TV, or seeing what they're wearing in their interviews on CNN or whatever. That's how you can kind of get some ideas of what you can do. The shirts, most of the time people are saying wear a white shirt or a pale blue shirt or a pale lavender shirt or pale pink, but you can do smart colors too, right? So I've seen some people do a blue with very fine, like a top that's got some fine pin points or pin dots or whatever. I've seen very fine stripes. It is a different world with shirts. I mainly say if you are simplistic and you can make it streamlined, then people are going to say that you look good. For accessories, all right, now listen, you gotta use pieces that they're not signature pieces. You should not have the big old amulet that you save when you want to go out and be like, yo, this is my I'm about to go to brunch look. No, take that thing off. You need to have simple, understated pieces. Pearls are golden in this situation, like little small pearl earrings, a pearl necklace, a tennis bracelet, a tennis necklace. I am on the fence about those necklaces that have like your name written in them in gold. They're very thin, and they'll say like, you know, whatever, they're Trinity, whatever. Look, nameplates are nameplates as far as I'm concerned. Unless it's something that you never take off because of who gave it to you, then feel free to remove that in the day of the interview and put it right back on as soon as you walk out, or as soon as you log off. And then a simple watch. So women's watches are usually very sleek. They're made in a way to kind of like accentuate the piece in general. So I think that most women watches are great. Just stay away from chunky joints. The Michael Kors chunky joints are not what's happening right now. And then a lapel pin can also be used for women. Now, earlier I said a tie clip for men. A lapel pin is similar to what that accomplishes. It is a small something that denotes a flare, but it is usually understated. So don't put like a full-on piece like a brooch. That's kind of old school. You would look like your name was Agnes. If you use a small lapel pin, something that is cool, they will say it and say, oh, this is unique as character. Hosiery. Now, I know this is a very touchy subject for some people, mainly because there has been some deviating thoughts on whether or not like shaven legs versus bare legs, whatever, and versus actually having on stockings. I am from the school of where I believe stockings are extremely refined and it makes you look professional. So stockings seem to be what I've heard most commonly as acceptable. I would recommend wearing them and using the stocking colors that make sense. Shoes, kitten heels, short heels, great. Please don't have any 6'3", anything larger than that. If you could wear them out to a club and look like you are taller, you should probably not wear them in the interview. You got it. The gray areas, these are the areas that people are like, I don't know what to do really. So first and foremost, belts match shoes. Do not pull up in there with a belt that is of a different tone than your shoes. This is basic 101. You should learn this on an Easter Sunday. White socks with any other shoe than a sneaker is weird. You should definitely not have on tube socks on an interview day. I'm sorry, just don't do it. All right. So when I say hair should not be distracting, understand that I am giving you, this is a statement that has so much wiggle room in it. All right. In classical terms, we have never seen a sheer degree of comfort with people having natural hairstyles up until recently. Now those rules have changed to the point where even in the military, you can have natural hairstyles. So understand that the rules are being constantly rewritten around hair. The major thing that continues to be across all of these rules is that it shouldn't be distracting. So with that said, I'm gonna go through 4 or 5 different hairstyles right now. I'm gonna start with locks. As a brother who's been locked for a number of years, you can see my joints bang. At the end of the day, I make sure that in an interview, I have them pulled back from my face because I want them to see me. I want them to interact with me. I don't want them to sit there and be looking at my hair and wondering if one piece is moving over here or whatever. So I pull them back. I pull them back. If you are, if they're long enough to throw in a bun, do the bun. If they're not long enough to do in a bun, you can just put them in a ponytail. If they're not long enough to be in a ponytail, then just make sure that they're twisted as tightly as possible. I'm talking about they need to be like a straight Tom Brady spiral tight. That's how tight it needs to be. All right, twisted, edged up, clean. I'm just surgical. You want someone to look like they took a Bible page and just singed each part of your hair to make sure that it was chiseled perfectly, right? That's how much you want to be. I'm talking angles, 90-degree angles on your lineups, all right? And even in the back. Now, if you have colored locks or locks with shells, try your hardest to put the shell in the back or pull it away, because if you have tips that are dyed, this is going to be somewhat distracting. I'm not going to tell you to go get the tips turned another color. I think that that's unnecessary, but I will say pull away from your face so that they're not like looking at the different gradations of your hair. So that's locks. Afros, or what I like to call the rich homie Quans. That's the people with the little whoop whoops and it looks like a little mushroom top. Like my man Jacob, almost the entire Kentucky basketball team, that hairstyle. If you looked at the Wildcats, they all have that little. So for men, this style is becoming more popular. People are okay with it. What I'm not okay with is if you have the top part and it looks like this, they're not gonna rock with you. You gotta tighten it up. The sponge brush, I'm not 100% fan of sponge brush to the extreme on those days. If it looks clean, most people are all right with it. So make sure that the fade is good. For women with curly hair and voluminous hair, usually volume in your hair means you can do a lot of stuff. Here's my thing. There are several days in a year, but not every day is your interview day. So on those other days of the year, you can definitely come out with the hair to here. You can have the Angela Davis fro. You can have the curls that kind of like tendrils. Yeah, that's fine. But on your interview day, let them focus on you. Let them focus on your face. Let them focus on the things that are coming out of your mouth. So I'm not saying press it. I'm not saying somehow get rid of the curls. I'm telling you to tame them a little bit. You know what to do to make them lay down a little bit more. You know what to do to keep the volume from being out here to maybe a little bit closer here. And then always make sure that they're pulled back enough to where your entire face is what they see. Why this is important is because you're going to be doing these via Zoom now. All right. If I'm looking at your Zoom screen and I see more hair than your face and it disappears the background, I don't know if I'm going to be able to it will come off as a distraction. So you got to be smart about how you use the backgrounds. I've seen some where because on this you can use a background and it's a green screen effect, it's taking away some of your hair and it looks odd. I don't know if you have that effect. If you look at me right now, some of my hair is kind of like, so practice that. Put your hair in a hairstyle. Get on Zoom. Zoom with a friend. See how they see it. Like, does it look like it's okay? You can run this. You can dry run these things. All right. Facial hair, piercings, take it out. Just take it out. It's one day. It's 15, 20 minutes to an hour out of your day. For your facial hair, make sure that you're clean. Trim it up. And that's for everyone, men and women. All right. Natural makeup. So I've been told that using makeup that is more natural to your skin tone and more natural to your look is better for interviews. So that means like staying away from heavy eyeshadows and smoky stuff and trying to use color in different ways and outlines. They said to try to be as natural as you can in it so that they feel like they're getting it. And I think that there will be a little bit more wiggle room with this, given that now interviews are going to be done virtually. So I will say, like, you can probably do a significant amount of makeup work on your end prior to your interview. my main thing is work on the reduction of glare and glimmer, because you're going to be doing these interviews probably with a ring light or something that's going to add direct light to your face. So make sure that you have the lighting right with your makeup so you don't look crazy. All right. Over accessorizing. I told you guys, super embellishing stuff. It makes it look like you have something to hide. Like, why do you have on all these chains? Why do you have all this other stuff? You're the candidate. Be confident in that. All right. And then things that are too revealing. On Zoom, I don't think we're going to have that problem, but I've seen candidates come through with tops that were too low, tops that, or pants that were too high. I've seen guys sag on interviews. I've seen all types of stuff. And you're just like, man, today of all days is not the day to do that. Questions about tattoos. So people are tatted up these days, like got sleeves, got neck, hand, face, tats, all types of stuff. The general consensus is that tattoos that are in places that can be covered should be covered. If it's not in a place that can be covered, like for example, if it's a tattoo that extends onto the hand or the wrist, try not to bring attention to it, but you don't have to hide it. I've had some people use concealer to cover up parts of their tattoos to kind of create a natural base. If you are a guy that's never used concealer and has no understanding of that, you should holler at a friend. And if you want to use that, they can help you apply that concealer the right way. And then at the end of the day, you can also gamble. For example, there are people who have like a tattoo that means something to him. I saw one guy in an interview, he had a tattoo of a brother that had passed, and I didn't think anything of it. This is in residency, and I just was like, all right, that's what's going on. But we were also in the Bronx, so understand that the character of the program was different, and so we were accepting of that. That's why you have to know where you're interviewing, because they may not be down with it. All right. Jacob, did that help out? Did I cover? Perfect. I see you gave me a thumbs up sign. All right, cool. All right. So now we're going to speed through some of these things. The interviewers, outside of what you look like, are going to be focusing on some key characteristics. I would screenshot this page, or I would highlight it in my little session if you had it. The fact that these are the things that you can affect. These are things that you can build, and it can come across as a strong interviewer. One of the ones that you're going to really see evidence on is now social awareness. I put this on a slide years ago. Now more than ever, they're going to be wondering, how aware are you of what's happening and what's going on around you? How can you weave that into what you're going to do? So think about those. Communication and interpersonal skills, always something that is great. Enthusiasm, charisma. Most good interviewers have a degree of enthusiasm. Here's a little tip that I use on video interviews. I sit at the edge of my seat. I mean, I poke my butt out, man. I don't care. I pop up into the seat so that you feel like I'm jumping out at you, because you can tell my enthusiasm. It's hard to tell enthusiasm from a video. So here are some tips. I'm trying to give y'all the blueprint, right? Other things that you can do in terms of like showcasing the fact that you have confidence is smiling. Smile in your interviews, because otherwise it looks like you're just super nervous. All right. Other activities with the interview. So this is kind of like, I'm going to speed through this slide because half of this doesn't matter anymore because of COVID. But I was basically saying that there are things that you might do on interview day outside of just the interview. Half the time it means they're going to take you around the school. They're going to show you people. They're going to give opportunities for you to engage with the school. Unfortunately, that's not what's happening anymore. They may do it all virtually now. All right, now to the nitty gritty. The interview itself. Most of the time they will do 2 to 3, or they can do as many as 5, like micro interviews. All right. So there's a nice way of doing this. They usually want one person who's currently a student involved in the interview. They're usually going to want to have somebody who is a faculty member, and they're probably going to have somebody who is executive faculty or executive staff. So you'll get to talk to a vice chair or a program director. You'll get to talk to another person who's faculty in the hospital or in the school. And then you'll get to talk to somebody who's actively at the school. It's usually more senior. That is usually the anatomy of an interview day. The group interviews are not going to happen as much anymore unless they invite you to a Zoom like this and all the interviewers in one space. So expect that to be one of the strategies that schools are going to use in this coming cycle, is they'll have you Zoom in and it'll be 4 people. And then they'll just ask you questions like this. All right. One of the key things here is that you get to keep your answer focused. Now, now that the interviews are via Zoom, there's an easier way to keep yourself focused. If I told you I had a sticky note right here next to my screen, would you be able to see it? No. So I can literally put my answers on the screen on sticky notes. I can put an entire easel next to me where I have things that I can refer to. So you got to use your skills and your tricks. There's a value now that you have essentially decentralized the process of interviewing. You can do it at your home. So you can build an environment that makes you more successful. Think about those things. But you can write your answers down. You can write bullet points of your answers to keep you focused. Avoid being self-centered. So that is when you start going off on tangents that are specific to just you, not an experience, not a point you're trying to make. You're just talking about things because either you're nervous, you're rambling, or you sound like you are self-absorbed. And then always turn your weaknesses into strengths. We spoke briefly about mini interviews. This is what I think is the strategy for the upcoming season now, is that I think they're going to do mini interviews via Zoom, multiple ones, one session. All right. Think about this being like speed dating inside of a Zoom call. And your goal is pay attention to who's talking to you. So when you look in Zoom, be able to look at all the names, maybe even write all the names or hover over their icon to see their names. And then try to be as communicative as you can, right? Because they are trying to figure out what they can about you from this screen, this window. They're looking at your verbal and nonverbal cues. They're looking at, are you, distracted? All of those things are going to play into account. And then some things that we never had to face before, like they'll be looking at your background. They'll be looking to see what's behind you. So it may make sense. A couple tricks of the trade. One, if you have design abilities, make your own backdrop. Design a backdrop. You can go to Canva. Canva. It is a free web software that allows you to do quick designs, and you can make a design on Canva and then just throw it in your background. It's literally a whole thing called Zoom backgrounds. You can just download a Zoom background and throw it up behind you. Second thing, if you're one of those more natural people, like I want to create a living space that has movement and stuff, be careful about how you do that, because you want to focus on lighting and try to eliminate distractions in the background. And the last part I would say about the way that they're going to be evaluating you is, do you have the optimal equipment? So speed of your internet is going to come into play. All right. You want to try to, for interview season, just for a few months, go and upgrade your internet package, because you want to have them come through as clearly as possible. 2, make sure that you have a device where this camera has good resolution. 3, invest in lighting for your interview or borrow some. And then 4, you want to have a microphone set up that is crispy clear. Right now I'm using a podcasting microphone, but you can use any other variety of things to make yourself sound clear. All right. So I kind of just skipped all of these things. I wanted to give some stuff off script. They're going to ask you some of the standard questions. You know these questions well. So I put some in here just to show you. The main ones that I think are going to come this year are going to be built around COVID, are going to be built around social justice, ways that you feel like healthcare operates at this intersection. People are going to say 1,000 times, it's an exciting time to be in healthcare. It's an exciting time to be a part of medicine. It's an exciting time to be da-da-da-da. Why is it exciting? Can you explain to them why you think it's exciting? Can you explain to them how you feel that you're going to be a useful member in the healthcare environment? Start thinking about those things. But you're also going to get questions like, why do you want to be a doctor? What's the most difficult stuff you've encountered? Your standard run-of-the-mill questions. So wow them. They got time. They now more than ever, they got time because they can do it right there at their house in their comfort of their home and then really dig into you. So think about that. All right.
All right. Excellent. Excellent, Dr. Brown. Thank you.
I think we're done.
Have,
yeah. Oh, wait, let me just do this one real quick. Just this last one.
Okay.
This is the most important slide out of everything.
Right.
All right. Sorry, guys. I'll make this concise. This slide is showing the results of a study. The study basically gave a point value to a bunch of different features that happen for interviews, right? This is the way that they rank the value of these metrics. And the people who were ranking them were admissions committee members. So they said, how important is it that the MCAT score is within a certain range? How important is it that they have community service and leadership experience? How important is it that they have a good personal statement? So the column that you see on the left side of your screen is, this is what it takes to get an interview, for them to invite you. This is how they rank you. This is how they rank your application package. As you can see, the most important thing was GPA and MCAT scores for invites. Now let's look over at the other column. The people who got accepted, the most important thing was the interview, followed by letters of recommendation. So you can just draw a line right there. You're telling me, somebody put in here, I think there was a question about GPAs or whatever. At the end of the day, what I'm showing you is that the GPA and the scores will get you an invite if it's over a certain threshold. But what gets you that acceptance is not the GPA and the score. It is going to be how you come across when you're talking to somebody, and whether or not people can validate what you're saying through their writing, not yours. So keep that in mind.
Okay, excellent, excellent. Thank you, Dr. Brown, again. There were a couple of questions that I think one is really important, and someone asked it earlier, and I'm not sure the person's name, but how do you appear, especially now in the world of Zoom and virtual presentations, how do you appear confident versus being over too relaxed, too giddy, cocky? How do you gauge that? What tools could help you to gauge that for yourself?
Got it. All right. So again, camera angles matter. I tilt my camera up. It looks like I'm relaxed. Problem. I tilt my camera down. I feel more of the screen. I'm balanced. I'm symmetric. Very simple fix, right? Lighting. My lighting is even distributed on my face. The light that I have is up here and angled downward. There are YouTube tutorials for all of this stuff, right? So if you're somewhere and you're sitting down and you got a laptop and your angle is like this, it's gonna look weird when you're doing the interview. So you may need to get a stand that allows your laptop angle to be like this, okay? You wanna be square in the frame. Second thing you wanna do, as I told you, I pop my butt back and I sit a little bit forward so it looks like everything I'm saying is coming at you. And that's because there is data that already shows that people are more engaged when people seem to come across this way. So I'm telling you that these are the little small tips and tools. Smiling helps you relax. And on top of all of that, this is a tool that I learned when I was in medical school. I'm not medical, when I was in I was giving a major presentation in undergrad, my seminal presentation in biology. I had friends in the back of the room. They were sitting in the back row of the room and they pulled up signs. And I didn't know that they were there. Well, I knew they were there, but I didn't know they had a sign. But they put up signs that were like, "Go Italo, you got this," while I was doing my presentation. And it was like a cheering section, just all of them were quiet. You can make a cheering section at your own house. You can literally put signs up and build it around you to make that environment as comfortable as possible. You can burn a candle, you put on some incense, you do whatever you want to do to make that environment yours, because what they gonna say, it's your house. As long as what they see in front of them is the candidate, and the candidate appears ready and prepared and confident.
Okay, I don't see any other really pressing questions that either you didn't address or Dr. Miller in support have already addressed either by typing it in. So does anybody have anything pressing? Because we are going to wrap this up a little early. And if so, just send it in and we will try to see if Dr. Brown can address it, or Dr. Miller if he has to leave. Okay. All right, I don't see anything else. Thank you again, Dr. Brown, for all of your support. Thank you.
I really appreciate you guys, and I enjoyed this talk. Nah, man, I appreciate y'all. This is incredible, and I think you all did an excellent job. To have 70 participants and who've been locked in for this conversation is a testament to how well organized this was and how important it is to have this. So for the participants, I'm telling you guys, you know, those materials that they're providing are invaluable. Even though you may have just registered or whatever to get this, it is invaluable and you can use it throughout life. One of the comments in the chat said, or one of the doctors that commented in the chat said, a lot of this stuff is not just limited to your pursuit of medical school, but you can use these skill sets far after medical school. I still use the same style of writing for personal statements. I still use the same interview tactics. I update them, but for the most part, this is transferable. You can use it as far as you can dream for yourself.
Great. All right, thank you. We know you have another appointment.
Yes.
And, please drive carefully, be safe. And thank you again. And we'll close out with a few more remarks to the students. And we're gonna close this whole session.
It's been a pleasure, you guys.
Okay, thank you.
Taking off.
Okay. Just to wrap up, I would like to just add that, again, PMF will be doing numerous virtual sessions. Some of you asked about mentoring and networking and mock clinics and all of those things. We're trying to plan to support you, letters of recommendation. A lot of this you can, check on your own. Some of you need really good letters of recommendation, but that's a connection. And sometimes we even, hopefully in the future, will be able to provide opportunities for you guys to work on a project. And one of the projects we're looking at is to try to find a national registry for students who want to become doctors, who are African American and Black, and minorities who want to become doctors, so that there can be a connection. They're not connected yet. Even the Student National Medical Association hasn't put that out. So we're working on that. So pretty much, unless somebody has any pressing questions, I think Dr. Miller and Dr. Brown and Dr. Brooks may have some final words, and we can close this one out. Dr. Miller, do you have a final few words? Are you still on? Is she still there? Okay. All right, Dr. Brooks, you got a final few words to close out?
Yeah, I just have two things I'd like to leave us with as we close. And it's really a quote from the commencement speech that I had heard, and it was given by someone who was giving it at Indiana University. And it said, "You must knock on doors until your knuckles bleed. Doors will slam in your face. You must pick yourself up, dust yourself off, and knock again. It's the only way to achieve your goals in life." And I think Italo told us that in his application process and what have you. The next quote was Chris Matthews, who said, quote, "If you want to play a game, go to where it's played and find a way to get in. Things happen when you get in the game. And by coming to this event and others like it, you're getting in the game. So you are going to be successful."
Thank you, Dr. Brooks. And for my final word, I would like to encourage all of you to be advocates for yourself. Please engage in organizations, be supportive in terms of projects that you may be interested in, that you may even volunteer and be surprised, and there could be even a stipend for you. It's really, really, really important. Again, I sit on this committee of awards for scholarships, and I notice the students who really are doing that, the ones that seem a little bit less selfless and a little bit less trying to promote themselves, and really trying to take care of the people that they ultimately will serve. Hopefully that's been you. So I wish you all the best. We will keep your emails, we'll keep your contact information. And for those of you who are not in California, stay in touch. You do it through the website. It comes directly to one of us, and we will follow up and try to be as supportive as we can of you. Thank you all for.
Hi, Stefan. I finally got unmuted. I guess anyway. Nobody wanted me to say anything, but I think this was just wonderful. This was our first attempt to do something virtually, and I'm so happy that so many students were able to come and join us. Their questions were thoughtful, they were insightful, and I'm just really pleased that so many of you all are interested in medicine. I think if you let your passion, if you're honest about your passion, if you explore your passion, then you're going to end up presenting yourself in the way in which you want people to see you. So always be driven by your honest passion for what you do.
Thank you, Dr. Miller. And one final thing. I think when Dr. Brown mentioned this to you, it happens all the time. Say you want to be a doctor, because when you say medicine, there's many fields, but when you say doctor and medical doctor, it takes on a different meaning. The whole question of medicine and medical services and how things have been going around, it's a little confusing. So when someone asks, what do you want to do? And you say, I want to go into medicine. Somebody like me, I don't know what that means. You need to tell me I want to be a doctor, or I want to be a nurse, or whatever, so that it's really, really clear. Take that, own that. You will succeed. And thank you so much. And anybody else that has a comment, would you like to share it? Otherwise, we will call this a day. Any student
I have something to say. I posted something on the chat. If you wanted to see more of Dr. Brown, he actually did an interview with Wired magazine, or GQ, sorry, GQ magazine, where he, as an ER doc, starts to break down some movie scenes, and it's actually very entertaining and very funny. So I would highly encourage you all to see more of Dr. Brown on there. So
that was Agoma Issei. She is an MD PhD candidate at UCSF, and we love her dearly. She works with PMF, so she's a great resource. Anyone else has a comment or something to share?
I tell a coronavirus joke, but it would take.
Al, you just like coronavirus. Thank you. Let's see, do you have something that you would like to share?
No, I would tell you. Can you hear me?
Al?
Yeah.
We're going to go to Tracy and Carolyn to see if they have a comment.
Oh, okay.
You have to mute.
Okay. Okay.
Hi. I'm giving some weird feedback. Sorry. I just want to tell her what I was going to say.
We have to be careful about Dr. Brooks's jokes, guys. That's what that was all about.
It was totally benign, but that's okay.
So I want to remind you guys about the certificates. For those of you who have stayed on all three, will definitely be receiving the certificates. And so you guys will all have that, okay? And Al, if you want to tell your coronavirus joke, please go ahead.
The only thing I was going to say is I was going to tell the group a coronavirus joke, but it would take them 2 weeks to get it.
Oh, please.
Okay. Thank you, everyone.
Oh.
Take care.
Bye-bye.
It's an inside joke.
Thank you.
Thank you.
Thank you.
Thank you so much.
Thank
you, everybody. Really appreciate the time and opportunity.
Thank you.
Stay safe.
Thank you so much. This was fantastic. It was good to meet
Yeah.
all of you.
Thank you. This was so
See you in the future,
good.
Stefana.